keep that as one of the core things and tech-driven, openness. These are the kind of things which others have told us previously. So we are in a good place to set forth collaboration, openness. So for example, we bring in a lot of innovative ideas, a lot of medical problems. So 1,700 doctors plus paramedics. India huge inputs at the right stage of training the new generation of healthcare and paramedicals. Most neglected in patient centricity is getting in this audio. So, I think the approach is to we have a lot of CSR partners, some of the innovation, some of them they have. So we get CSR support to do and startups, new technology, different perspectives, openness. These are the driving mantras of what we do ahead. And a lot to do. I also supposed to add who are the people with the least voice. Digital audio. Disabilities. By default. Children with disabilities, elderly, and people in very remote areas. So these are the kind of people which we would like to focus on. And geriatric care again is that narrative has fallen behind, and we are as a secretary I'm trying to push more funds into that space. Even we had a meeting with Niti Aayog, and we are trying to take up elderly care and geriatrics and patient centricity. I'll just give an example, it won't take much time. Often diseases are confused between aging, and diseases in elderly are confused. So we are unable to differentiate, like how said the pain has to be borne by the women. Sometimes old age depression or post menopause depression may be saying it's aging. It's not normal. Maybe it's early Parkinson's, maybe early Alzheimer's, but we can think of it as aging. So there is a patient centricity also means going to the individual's story, context. So we hope to build all that into the system. Thank you. Wonderful.
So the openness is something which can really drive certain transformation. So before I go with the last round of question, let me open the it for the floor. And is there anyone who may like to ask any question to our speakers? I think I see a hand at the back. Can somebody pass on a mic?
Hello, sir. Sir, audible?
Can you stand and introduce yourself also, right?
Definitely, sir. Hello, nice to meet you, all of you. And thank you for your precious time like you had given for this conference. And it's good for us to, have word with you people. I have a question for Mr. Saurabh. Thank you, sir. Saurabh ji, I just wanted to know, I'm Dr. Arvind Lakhwan, by the way. I'm a dentist by profession in Mumbai from last 24 years. I'm from Dr. D.Y. Patil Dental College, Nerul, New Bombay. I have a question. I'm into tech also. Basically, I'm from a tech background also. Instrumentation I had done it. I have a question: how your nanotechnology is working? I mean, you talked about like sterilization, right? So how is that function?
If you may give a brief answer for that, because this is something which can also be taken up on the sideline of the event. So, but since he has asked, so
I'll briefly categorize into two modes. One is the surfaces we touch, and one is the surfaces human just get, like catheters and the kind of pipes you have in for the condition. So primarily the cross-contamination happens from the largest of hard surfaces where we touch. So even the staff, even the patients who come there, ICU beds, OTs, you don't know what kind of pathogens are present on any surface. So the technology works on protecting the surfaces at a larger level so that the cross-contamination and
How?
the kind of...
So the scientific detail you can discuss
I can,
maybe
I
on
can
this
give you
one.
the
Okay,
details.
Yeah,
we
because-
can meet.
yeah,
Sure,
yes,
sure.
during
Our purpose is that how his technology is driving patient safety.
Sure, sir.
The exact, the know-how
In
or
my-
the process
yes.
can be, I think, described separately also. So do you have any follow-up question on?
No,
Okay,
I
right.
will speak to him.
All right, thank you.
Thank you so much.
Anyone else? Okay. Yeah, please. So the mic is. So you go on.
Hello, good morning, good afternoon, everyone. I am Dr. Ankita Naik. I'm a practicing pathologist with Orange Health Labs. Thank you, IHW, and the esteemed panel here for the brilliant discussion, because we at our lab try to promote digital diagnostics, more approach towards having a digital access, so that the most common problems that we face is that the patient is late for reports and then cannot consult. But my question was that, sir, like you explained about precision medicine. So we have very high hopes from precision medicine, especially in the field of cancer and all. But how do we go about with precision medicine and it being feasible and affordable also? Because the more targeted we go, the more difficult it becomes for people to understand why they need the precision treatment also.
Yeah. Thank you for asking that question. And first of all, you guys are doing a brilliant job in
Thank you
Orange.
so much, sir.
I use your services. You're the fastest and doing really well. Look, I think I'll answer your question in two parts. First part is see from where we've come. Yeah, 20 years back, these diseases, without having precision medicine, you eventually had to rely on chemotherapeutics, and survival rates in some of them were as morbid as 4 months to 6 months. To the time today, we're turning the corner. In some of the diseases, you can even say that, that it's actually turning into a chronic disease, where you're talking about survivals upwards of 5, 10, 15 years. Still a long way to go, but that's what the delivery on precision medicine. I think the other aspect, in my own personal experience, is we don't have to always, look west and implement east. We've got enough talent to do some of the stuff. And I'll give you an example. BRCA mutation, which was one of the efforts to set it up in the country. The initial cost of diagnostics itself was $5,000. But today, if you build up the capacity, and which in India is possible to do, and you can even service, Southeast Asian nations and others. So at the end of the day, it's all about scale. And since you're from diagnostics, you'll know that scale and cost go hand in hand here. So as you increase the scale, the cost went down, and therefore, today, the world's cheapest companion diagnostics in BRCA mutation is done out of this country. So there are ways to solve this problem. It may not be evident on day one, but if we are all together at it, we can potentially solve. I think the third aspect, where I'll really compliment my whole pharmaceutical industry, is from an access and affordability. The medication in India today is probably the least you pay for anywhere in the world. Apart from this, there are patient access programs which are there. We're still not solving for that man who, Mahatma Gandhi referred to, and I must put my hand up to say, but Beyond that, we're also solving for a large population the access and affordability with these patient access programs as well.
Thank you, sir. Sir, if I may, just one small question for Mr. Naveen, sir.
Yeah, please go ahead.
Sir, as we go into the medical field, our first access of patient-centric programs is the Anganwadi and the rural social workers. Is there any programs that you're looking forward to train them even with the digital access, like we're talking about digital access? Rural India slowly is getting the networks and accessibility. So are we also looking into making them tech savvy?
No, absolutely. When we say taking healthcare to the doorstep, it's not just tech, but tech along with the people who are going there. So in fact, I'll be happy to state that in the last few years, we have at the back end, let's say the back end, meaning our all our PHCs, are 2,000 of them. So we have given connectivity and PCs and so on. And our ASHA workers and Anganwadi Sevikas are slowly getting digital. So ASHA workers largely have been given tablets. So the unbelievable amount of paperwork in healthcare. You'll be most surprised in government. The police department and healthcare have insane amount of paperwork because accountability and so on. Lot of it. There are like 20 websites which from Government of India we have to keep filling up data, and we have data crunching is a huge part. That's what keeps public policy relevant. So we are trying to put all that into digital realm. So we get like a 360-degree view of the patient. So the health records are slowly getting digital, and the services. So one of the most surprising results last few years is that the telemedicine is being adopted by people hugely, huge. And it's very, very popular, and it's cost saving, time saving, and we give access to specialists. So we are pushing them, and of course, digital illiteracy is a big, big thing. I'm not just talking of Anganwadi, Sevika, or ASHA workers. The doctors also have a certain, I would say, not a knowledge gap, but a mental block in adopting
it's more
digital.
of a resistance than
Yeah,
the
it's a resistance. So
illiteracy.
our Directorate of Healthcare has been playing around with different ways to get our doctors to prescribe digitally, right? So the effort of typing, and so we have given them tablets to write, voice to text. So there is a certain threshold we are unable to break through to make the workflow fully digital. And if that happens, hopefully with the new generation, new tech, I think the next 5 years are going to be a golden period for digital healthcare in Maharashtra.
Great. Ma'am, a very brief question.
First of all, thank you for the new concepts, and I'm so happy to hear patient centricity as a center of this whole anchor. I represent an organization called Patients for Patient Safety Foundation, an extension of CAHO. Everybody talks about healthcare, doing this. All of you are doing a brilliant job. Where does the patient herself or himself form part of this whole exercise? What can be done to involve us as people to partner with you rather than just receive help, receive aid? Just fishing rather than just give us fish. That is my submission.
Gaganji?
Yeah, I think, like I said, as we're moving, and I think in part of this thing was around the clinical trial program as an example, where, we're bringing in the voice of patients. Personally speaking, the voice of patients was more around in the go-to-market scenario usually, but now it's pretty early even at a clinical trial stage that you're doing. I think the other aspect of it is really in terms of co-creating solutions when it comes to rare diseases. And I think one fantastic example I see in this country is the way the Hemophilia Federation has come along, where patients have participated, and so there is partnership between patients, government, and company as an example. And I think more and more of these is what we will see in future to really take care and drive the voice of patients into the way they want to be treated, and as well as the outcomes that they would like to see, which are driven.
Thank you for that answer. We are doing it on generic topics and disease-specific topics, and we would need all your help to promote it to the masses. Thank you.
Sure, and it's already happening. I mean, take the case of example, you know, just 4 years pre-COVID, 5 years back, you know, if you picked up celebrities and when they had carcinoma, the treatment was always invest. Yeah, but now we have celebrities who've got treated here, and they're coming out and talking about how they're surviving and how they're thriving and how you know, they've got the best in treatment, world-class treatment available in the country. That's again a voice of the patient, and is giving a lot of hope to people who couldn't have ever afforded to go to West to say, look, I'm going to get similar level of treatment here as well.
I can just add very briefly
Yeah,
to
please,
that.
please.
No, thanks, madam, for that very valid question. Now, you know, my personal opinion, you know, is that one, we need stories out there, right? Now, this is the area of social media. There is so much happening, and slowly we are realizing it can be visible, it can be seen, can be heard. Extraordinary human stories, both from the doctor side and from the patient side also. Difficult decisions have been made, things. And sometimes we need failure stories also, right? So there is a lot of criticism on the term cancer warrior, right? Or cancer survivor. It's not that those who have succumbed to the disease have failed, right? That's the nature of the disease. So, you know, if you take a cancer patient, I had a long thought of this. Where does a critical care patient's treatment end, right? It ends on multiple axes. If you see like XYZ axis, one is a axis of the biology and the medicine itself. The other axis is money. When the money runs out, there may be so many people who cannot afford further care. And the third is the very important thing of, you know, of the mental health and the support systems which actually, or the social net or the mental thing. So it's not easy to just pigeonhole people and their stories into known categories. So when we say patient, we think of one type of a patient, but every patient's story is different. And till we understand the heterogeneity of the needs and the solutions, care. So we need those million voices to come. They will probably have a few thousand solutions. A million voices can have 1,000 solutions. So I think social media, more non-profit NGOs, and this is the kind of interface which I think will really help. And it's a collaborative approach. So I'm just taking just one more minute. It's like a famous story about they built a big campus and they wanted to call the landscape architect to connect different buildings for pathways. So the architect never built the pathways, let the people walk around. Then he found the pathways that people had really created, and he designed the pathways on the natural paths that people had already built. It was the most efficient one. So I think people will also need to speak out, and they will teach the government, they'll teach the pharma what to do. So I mean, hence openness is a key.
Yeah. So, no, I think you can continue after this. We are already, you know, out of time. So, sorry. You can obviously continue after the session. So, a quick one. So, what I could, you know, conclude out of very in-depth inputs given by all of you is that openness of the government to improvise, to accommodate various inputs, opinions, and also mechanisms, and the innovation and the patient-focused approach of the pharma sector, where they believe that just handing the pill to the patient will not be suffice, to coming up with innovative approaches and solutions like what Mr. Saurabh's company is doing, and also what Ashish ji mentioned about that, not going with the assumption that what the patients would need or what the beneficiary would need, is going to create a patient-centric healthcare which will take care of the every patient's need, including the one with the maximum needs or the most needy one, as kind of visualized in the maxim by the Mahatma Gandhi. So with these words, thank you all for your kind time and participation in this opening session of Patient First Summit. And we look forward to your continuous contribution towards this important mission. And I'm sure with all your support and all your passion, we will be able to build a healthcare system which is truly patient-centric. Thank you so much.
Thank you, panelists, for your insights. I will request Kamal sir to felicitate the panelists. Mr. Naveen Sona. Mr. Gagandeep Singh Bedi. Mr. Saura Sachdeva. Dr. Ashish. I would request to all the dignitaries to come forward for a group photograph. Thank you so much. Kindly just wait for a few minutes. We are just setting the stage ready. Next, we have a keynote address on the topic Collaborating for Trust and Access, Pharma's Role in Driving Patient-Centric Healthcare in India. Mr. Anil Matai, Director at OPPI, whose expertise and leadership have been instrumental in advancing patient-first initiatives within the pharmaceutical industry, Sir, kindly join us on stage and address the gathering. Please put your hands together. Over to you, sir.
Hey, good afternoon, ladies and gentlemen. At the outset, I would like to express my sincere thanks to IHW Council for inviting me to speak in this forum on a subject which is very close to my heart. I have spent about 35 years in the industry and now recently moved into a role which is still related to the industry but doing advocacy for the industry. I remember way back in early 2000, this word came up, patient centricity, and followed by patient first. And this came from, as Gagan was saying, it came from the Western world. Even these words were coined in the Western world. And that time I was the CEO for Novartis, and we had a global initiative which was focused around patient centricity. But to cut the long story short, it is heartening to see that in the recent past, we have seen specific actions being taken by various companies, not only global pharma MNCs, but large Indian companies which are focused around patients. So, I mean, we are seeing, and also there's a skin in the game, especially by the pharma industry, which has further accelerated this, and we are seeing improved outcomes. So I think we are moving in the right direction. All we need is more acceleration on this front, because this is something which is very important, and as we heard in the previous forum, it's the patient which is the fulcrum of the business for which pharma industry is there. I mean, if there would not be patients, the pharma industry is not required. So we don't need patients, we need good health. So we need to move towards wellness. But all said and done, I think it's a patient, like I remember earlier in a famous film, it spoke of what are you doing? They said entertainment. For us in the pharma industry, it's patient. Also, it is heartening to see that India is moving the needle. For long, we have been the pharmacy to the world. And we have thrived on generics. But in the process, what has happened is the Indian patient has been deprived of access to some of the newer medicines. It is good to see innovation happen. Innovative medicines are coming in. We saw vaccines, we have seen biosimilars. So clearly the needle has moved, and the entire Indian pharmaceutical industry, both global pharma MNCs as well as large Indian companies, are now focusing on innovation and to bring in innovative medicines, biosimilars, vaccines to the Indian patients. Also, we are seeing a shift happening from just volume to now value. And in the process, what is also happening is we are looking at improving health outcomes. Ultimately, what is the outcome of the medicine which we are giving? It's just not that we are pushing in medicines, because earlier it was only you were producing and pushing. Now it is based on health outcomes that the pharma companies are focusing on. So pharma, for patients, patient centricity is emerging as a cornerstone for the success of pharmaceutical companies. Because moving ahead, it will only be those companies which are more patient-centric will actually succeed. Innovations like, we already heard in the morning, innovations like artificial intelligence are enabling deeper insights in collecting patient needs. Because it is absolutely essential that we capture insights of the patient, the journey of the patient, which goes into building our businesses of what we do. And to foster trust and improve access, pharma companies are prioritizing patient needs by delivering the right products at the right time, at the right place. With patients becoming more informed, companies are adopting a more responsive and empathetic approach to meet their expectations. It's not only the pharma companies, but also the doctors. because when a patient goes to the doctor today, they are much more informed than what they were maybe 10, 15 years back. So the future of pharma lies in adopting patient-centric marketing strategies, integrating data and AI to devise innovative and accessible solutions. While this journey to achieving this vision may be challenging, technology offers the tools to bridge the gap and enhance patient experiences. Real-time data, real-world evidence is becoming a vital tool in personalizing patient care. Moving ahead, it's personalization which will matter more and more. Pharma companies are increasingly leveraging data from wearables, mobile health applications, and patient feedback to continuously monitor and adjust treatment plans. For example, wearable devices like fitness trackers, smartwatches, and health monitors can track basic metrics such as the heart rate, activity, and sleep, as well as advanced indicators like blood oxygen levels or glucose levels for diabetes management. I was recently at another conference where I think they've done a study at Mayo, and it can detect diabetes just by hearing you. I mean, you speak into a phone, and just by hearing you, you are able to get to know whether you have diabetes. This was for type 2 diabetes. So pharma companies are also working closely between each other, collaborating with each other, with regulatory bodies to accelerate the approval and availability of new treatments. Because at times, the gap between a global launch of a new product and the time it was launched here in India was 10, 12 years. So that period has now come down to 12 years, meaning that an Indian patient is getting access much faster than it was. But why wait for even 4 years? We are working with the government to see to it that these timelines are reduced so that we can have almost a simultaneous launch. And as we repeatedly heard since this morning, technology is revolutionizing patient-centric care programs. I mean, technology is driving those programs by expanding the reach of healthcare services to underserved populations. I remember in 1993-94 when that time I was working for Glaxo and we were trying to do something on telemedicine and had tied up with the Israeli company. There was no one in India offering telemedicine solutions and it failed miserably. It was perhaps ahead of its time. So it's almost 30 years now that telemedicine is really picked up and that has really improved access to medicine for people living in remote areas of the country, and that matters a lot in a country like ours. Talking more specifically now about our own member companies, I'm standing here representing the global pharma companies which are present in India. So our member companies are dedicated to bridging healthcare gaps through, Gagan already referred to this, through patient assistance programs that meet essential medications and treatments more accessible. These programs provide financial aid, access to cutting-edge therapies, and holistic support for patients. Our member companies are actively running patient assistance programs to ensure patients not only gain easier access to medications, but also they are able to experience a seamless journey towards better health. We are collaborating with the government to develop solutions that enhance access to innovative healthcare products, ensuring a greater number of patients in India can benefit from advancements in medical technology and treatment. There's nothing new which I have said. A lot of it was spoken to in the earlier panel discussion, but as a closing remark, I would like to end by re-emphasizing that embedding patient centricity will help the nation and also the pharma companies in particular to transform for the future, because this is the kind of transformation which we need and it will be, I mean, if we don't embed patient centricity in our business models and continue to push products which we were doing in the past, we will not be guaranteed of success which was there earlier. Ultimately, we are in business to improve healthcare to a larger section of people in India, and as pharma industry, we are committed to that. And I ensure, I mean, on behalf of the industry standing here, especially the global pharma and companies which are present in India, that we are committed for this cause, and we will together ensure that patients in India have quicker and quicker access to medicine, which is reasonably affordable. We need to work on all the access systems around, because affordability or pricing alone is not the only factor which makes medicine accessible. We have to work around the entire ecosystem to improve access. Thank you very much, and all the very best for a successful. Thanks a lot.
Thank you so much, sir, for your address and enlightening us about pharmaceutical role in driving patient-centered healthcare in India. Now, I would like to request Mr. Kamal, sir, to come on stage again and felicitate Mr. Anil. Thank you. It is now time for an exciting and forward-looking panel discussion on the topic Advanced Diagnostic and Real-Time Health Monitoring. This session will dive into the transformative future of diagnostic, focusing on AI-driven solution, real-time health monitoring, and predictive analytics. The panelists will explore how these cutting-edge advancements are revolutionizing healthcare, particularly in addressing non-communicable diseases and enhancing preventing care. We are honored to have distinguished lineup of speakers with us today. We are just setting up the stage. We'll announce the name in 2 minutes. We are honored to have a distinguished lineup of speakers with us today. Mr. Surajit Mukherjee, Chief Business Officer, Niramai; Dr. Sachin Suryavanshi, Director, Medical Services India Business, MCure Pharmaceuticals; Dr. Saurabh, Global Medical Director, GSK. Guiding this insightful discussion is our esteemed moderator, Colonel Rajiv Manali, CEO of SUT Patom Hospital. Without further ado, let's begin the conversation. I'd like to request to all our speakers, please come on stage.
Good afternoon, ladies and gentlemen. It's a great pleasure being here, attending a conference with such an important theme as Patient First. I think the previous session has already set the stage for us, and also the context. We'll take it on from here now. And before doing so, let me thank IHW Council for organizing such a wonderful event here. And I understand that it is the 3rd edition. I also am grateful to a distinguished guest here who talked about patients for patient safety. I think that's it's part of CAHO, and I think movements like this are extremely important, and that is the context, that is the age in which we are today, and we are talking about patient first. And to come to a specific context, the theme, sub-theme within the theme, it is about diagnostics and monitoring, health monitoring, precise health monitoring in the context of patient first. I think it's, we are in an era today, I would like to call it a cusp of a revolution in healthcare, where there are a lot of things happening, technology is fast advancing, and we seem to be in a sort of daze as to what's happening. What is important today is not to be in that daze and lead that movement which is happening and be leading technology into helping an ecosystem where the patient comes first. I would like to see it in that context, and we would now go on to a discussion. The rules of the game will be, I will request each of the speakers to talk talk about their perspectives for about 10 minutes each. Thereafter, we will have a question answer session, and then if there's time left, we will go on for another. We'll discuss any of the aspects which we think are important. So here we go. We start with Mr. Surajit Mukherjee, Chief Business Officer, Niramai. May I request you to kindly give your perspectives.
Hello. So thank you very much, and very good afternoon. My sincere thanks to IHW Council, for having me here amongst such a distinguished and august audience. The topic that we will be discussing today is obviously a very relevant one, peppered with all the buzzwords, patient first, diagnostics, real time, sign of the times. One of the, since I come from an industry where we have a cancer screening, solution, and therefore pretty much embedded within the technology space, let me start by sharing, one recent example. In Sweden, between April of 2021 to July of 2022, they did a study wherein 80,000 women were, screened for breast cancer. Now, out of these 80,000, there were two groups, 40,000 each. One group, after they underwent mammography, was, the reports were diagnosed by two radiologists. Because in certain countries in Europe, a mammo report has to be read by two radiologists. That's the norm. And in the second group of the balance 40,000 ladies, their mammo reports were read by an AI algorithm plus a radiologist. Interestingly, what the results came out was, in the second group, which was AI plus the radiologist, there were 20% more incidence of cancer that was detected. And this was proven by histopathology biopsy. This was such a,
path-breaking kind of a study. It was also featured in Lancet Oncology, which, as you will be knowing, is a very prestigious publication. And another important takeaway from the study was the productivity of the second group, the individual radiologists and AI, was up by 44%. So we all know, what technology, the benefits that technology brings to the table. We are seeing evidence of that also happening. And I just wanted to share, this particular, study. And now they are doing a 2-year, follow-up subsequently. So we'll get to know, the second stage also. Coming to, technology and, its role in diagnostics, etc. The one thing that comes to mind very, very, from a very practical perspective, and we heard that in the previous session also, is the impact of technology on personal or precision medicine. And an oncologist today, and I was speaking to an oncologist just the other day, and he was saying that thanks to technology-driven quick diagnostic, molecular diagnostic solutions, today I'm able to kind of better communicate with my patient the various choices that he or she has. Earlier it was one size fits all, today is much more personalized. The discussion can be, you can first do a chemo and then followed by a surgery, or radiation followed by surgery, and immunotherapy can be skipped completely because your genetic profile, doesn't really require that approach. That's the personal or the precision medicine factor that's coming in. Of course, it's not as affordable as we would like that to be today, but then the good thing is that we're making that, we've begun that journey. And over a period of time, as we progress, I'm sure, this will become far more affordable, down the line. The other thing is, and I come from a startup culture. Niramai is a startup. We have a solution which is an AI-led breast cancer screening solution, which detects cancer far, far early. We talk about early detection because early detection not only saves lives, it also brings down the cost of treatment. Compare the cost of, say, around 250 rupees for one test versus mammography, which is minimum of 2,500 going up to 6,000. But yes, that's the benefit of technology. But how do we ensure the last mile connect? How do we ensure that the woman there, out there, actually gets the benefit of this technology? I think that's something where there's a lot of work that still needs to be done. We are seeing participation from the government, whether it is the NHM, state governments, et cetera. They're taking more and more interest in community screening programs under NCD. But then there's a lot more that needs to be done. But as we see, such screening modalities, technology-driven screening modalities, whether it is breast cancer, cervical, oral, these are the larger cancer buckets, today. The sheer advent of newer technology that is coming in, which is also getting clinically validated, right? It's not just about saying that, hey, this is what we can offer. What is the proof? What's the clinical evidence, that this actually works? And what is the longer term, evidence that this has worked? So yeah, we are moving in the right direction. There's a lot more that needs to be done, but definitely very optimistic. Thank you.
Thank you, Mr. Surajit, especially for that early screening facility which you described about what had happened in Sweden recently and how AI could bring in a difference in screening. Now, while talking about screening and diagnostics as a part of screening, I would like to interject a thought here as to why can't diagnostics be used to prevent? And since well-being is a context that we are talking about, how can we bring in prevention into various things which we are talking about? Diagnostics today means or it gives an impression that it's all about screening and detection. Why can't prevention be part of the diagnostics? To give an example, when a baby is born, why can't gene studies be done to sort of predict as to what are the problems that this baby is likely to have in the future? Now, gene testing, as we know, it's very expensive at the moment, frightfully expensive. This possibly could be brought down considerably to make it possible to indicate to the person concerned or the family that there are a lineup of problems which could be addressed to prevent that disease condition coming into being. So with this, I will now request Dr. Sachin Suryavanshi to give his perspectives on patient first.
Thank you. So you have rightly said, I mean, the prevention should be looked for, and the best thing, I think, the advanced diagnostics or the newer technology that has given us is predictive capabilities, so that we can work on the prevention at individual level and take some design the program for the preventive strategy as mass level. So we were talking about the patient first, real-time monitoring, and day in and day out we are being monitored by various devices. We are using the variables which are telling us when to get up, when to walk. They would tell us different matrices or the vitals that we are having, and do we need to work on those matrices. In terms of the patient if we talk about the patients, then the monitoring of certain aspects, whether matrices or the parameters in case of chronic diseases, is really being used a lot nowadays in clinical setup as well as in the clinical trials. For example, in case of diabetes, we can have real-time blood glucose monitoring of the diabetic patients, and we can decide when to act, when to intervene. The device is giving us 24-hour glucose monitoring. Right, I have conducted a study on diabetic patients, and it has told us that the unknown things, the unknown parameters that are troubling the patients. One of the lady patient was having headache, while her vitals were stable, her blood glucose was normal, her HbA1c was also normal. But what was causing a headache was the hypoglycemia, during a very short period in the evening. And that was detected by the real-time monitoring with the help of the device. And we could then, give those, readings to the physician, and physician could then modify the medications, anti-diabetic medications, so that hypoglycemia is avoided, the patient's headache is subsided. Same thing I had published in case of hypertension, the ABPM. There are devices which can give us 24-hour blood pressure monitoring readings, and we can detect when are the significant fluctuations in the blood pressure of the patient, so that we can adjust the dose or the timing of the drugs accordingly. So there are many areas in which this advanced diagnostics can be used for the benefit of the patient, putting the patient first. Surjit just mentioned about diagnosing the breast cancer, right? I mean, I was just going through the report, and it has shown that applying the AI to the detection of the breast cancer has really increased the detection by about 20%, which is sometimes beyond the physician's capabilities. So that's the use of the technology wherein we can have we can put the patient first for the better outcomes.
Thank you, Dr. Sachin Suryavanshi. When we talk about healthcare, generally there's a perception amongst the public that first healthcare is very expensive. It is not, there is an attempt by the healthcare workers or the organizations to fleece the public. And connected with this is a feeling that pharmaceutical companies are actually driving diseases and then curing them. This is a general complaint that one hears, especially when talking about why can't generic drugs be more commonly used than the molecular ones and things like that. So may I request you, Dr. Sachin, to dwell upon this aspect a little bit to say that what exactly the pharma companies are doing to sort of, rest this sort of speculation, put this speculation to rest.
Generic, drugs you are asking, right? So, I think that's the, future, one of the, thing that you already mentioned, in the introduction. The next biggest thing is, precision, precision medicine. And it would help us really to target the right type of the patients and give them the right type of the drugs. Nowadays what's happening all for example diabetes or hypertension or stroke or any kind of non-communicable diseases, they would have certain guidelines of first line, second line and third line drugs which are generically prescribed to the patients. But with the help of this advanced technology, we can in fact identify a particular drug for a particular patient so that the outcomes are better. Now what pharmaceutical companies are doing, so various areas we are we means all the pharmaceutical companies are working to give right treatment to the patients. We are giving some tools to the doctors so that they can identify specific parameters in the patient to choose the suitable drug for the the patients, for their patients. So yes, there are various programs that are being adopted by the pharmaceutical companies for the for adding values to the treatment of the doctors so that the outcomes are improved.
Thank you very much for that. Now I'll request Dr. Saurabh Fulmali, Global Medical Director of GSK, to give his perspectives on how we can bring patient first to the center stage.
Thank you for the question, and thank you for IHW Council for inviting us. I would say at first I'm very happy to be at this conference because this is the first time I'm attending a conference for patients. Every conference, in fact the last conference when Dr. Sachin and me were there, the first question is said is, where are patients? We usually have conference which is disease area specific or industry specific. It's very rare that we have the opportunity like this where we actually talk to patients and directly we communicate to each other. Well, there was a lot of discussion done in the morning, and of course my panelists also had approached and talked about it. Let me try to bifurcate it, like diagnostics or AI or the latest technology. It can be divided into various aspects, right from the birth till the later phase of our life. Let's start with the birth part, where now technology is helping us identify right in 3 weeks to 7 weeks to 12 weeks how the baby will be, whether there are any genetic abnormalities, or just a sonography can tell us how the baby will be, and then we can take a decision whether to bring this baby into the world or should we avoid it because we know how it is going to protect. So that's a technology where we are now predicting how the future of the baby would be, to the phase where we are early detecting our how we will move ahead or how we will be reacting to different medicine. Nowadays, wearable devices or Internet of Things have actually helped us to move to a very, very larger scheme. The best example, which we all have adopted, is Arogya Setu app. Okay, nowadays it's just somewhere hitting in our sitting in our mobile app, or most of us have deleted it. But during COVID, it was the best predictor to know whether if I am going to a particular area, are there any COVID patients there, whether there was any COVID patient who has been taking medication there. So there are things happening, and technology is helping us in a lot major changes. right from diagnostics, which both of them have covered, so I will not cover the diagnostic part, but even in risk prediction. What's happening nowadays is that because the data is available, we are now able to predict risk. There are a couple of papers, in fact I am author of a couple of them, where we actually predict in non-communicable diseases like asthma or COPD, how the patient will behave in next 3 to 4 years or in the next 10 years if he is taking a particular medication and if he has a particular characteristics. And that data will help doctor even to modify the treatment before those things happen. So it's actually risk prediction, not only diagnostic but risk prediction as well. More importantly, because of technology, AI or wearable devices or Internet of Things, it is patient who is also now getting empowered. They are, there was a question in the morning, are we a part of diagnostics, or when can we be a part right when the decision is made? Now patients are making decisions. We all know, we all make jokes about Dr. Google, but because of that, patients are becoming aware of the various options. Because of the wearable devices, patients are taking care of themselves. So technology is helping in all this. The only challenge is it's a change, and every time when there is change, we are afraid of change. So there is afraid saying that, oh, technology will take my personal data. Come on, you all have given your personal data to all the mobile apps. Everybody who has an iPhone, you have not read the entire 30, 60 pages document, you just click on I agree. Or if there is, you are taking about any apps, simple app like Swiggy also takes a lot more information from you than a data which you are sharing about your personal health. I'm talking about what we have done in foreign countries, and I'll bring that information to you. In China, okay, I did my field work in China, and I'll tell you something about China. In China, the technology is so high that when you go to a hospital, there is a kiosk machine which you see at airports. You have to just click, and they have symptoms there. You have to just click on the symptoms, and there itself the machine predicts what infection you have, and the machine predicts whether you will need medication or whether you need a doctor consultation. So before going to a doctor consultation, the machine in a hospital tells you, and these are government-run hospitals, tells you what's happening. So technology is far, far ahead. India is catching up. And just one question about that part, like the generic drugs which is government making available, or now the insurance which is having up to 5 lakhs or 7 lakhs, which is increasing for general public. I think because of that, the availability and the accessibility is taking care of it. The biggest challenge which we thought was that our Indian people are not open for technology. And we were it was just a myth, I would say. Because if you see, Indians are the highest in using internet. Indians are the highest in using UPI payments app. Even a farmer in the interior is now known how to do a UPI payment app, and for UPI you need internet. Okay, so they are using apps. The only thing is, they know the importance of using UPI because that is affecting their day-to-day life. If they understand that using the technology will also affect their health and it will affect their day-to-day life, I think it will be a game changer. And that's what pharmaceutical companies are doing. We are trying to educate and we are trying to bring lots of information. The challenge is, once you see a pharmacology face there, you say money making, exploitation of the patients, and etc., etc. So it's actually, we have to be quite open to that, and I think then we will see huge changes happening.
Thank you. There are two thoughts which come to my mind as I'm listening to the panelists here. One is that, are we driving technology or are we getting driven by technology? Very important to see that we must be driving technology and not get driven by technology. I will pose this question subsequently as to how we are managing this. Second aspect is, we, the healthcare fraternity, must be seen to be doing more than what we are required to do or supposed to do to ensure that prediction is the first line of activity that we would like to support and lead it from the front. No gainsaying the fact that today the public at large feels that while healthcare is required, that is one area which is actually fleecing us. This is a concept or a belief that we need to change. And that change has to be driven by all of us, healthcare organizations, pharmaceuticals, diagnostic companies, and things like that. So what can we do more to get this into the theme? That is something which I would like the panelists to address now in the next session before we open up for questions from the audience. A quick round of questions on this aspect. We'll start with Dr. Saurabh Fulmari.
Sure, let me start with that. So I think the first most important part is openness and trust. Okay, because a lot of times what happens is when we try to bring some new technology, there is a question mark whether it is appropriate, whether it is for me or it is only for high paying population. We are facing these challenges, but if you see where we are in the last 10 years, the affordability or ability to spend is increasing. Insurance teams or insurance agencies are now helping us to do a lot of diagnostics and pathology labs. There was somebody in the morning talking about it, that there are lots of diagnostic tests which they are doing, and there are lots of technology which is bringing up there. So we are there. It's just that we have to be more open about it. In terms of physician, myself or Dr. Sachin, or in terms of healthcare professionals from pharma industry, I think what needs is more and more education about it. Okay, there are lots of information which is available, but if it is coming from a proper, well-refined source, then it will actually reach out to a larger population, and then there is trust which needs to be built on. So I think those are the 2 points which I would say is affordability and trust, which can take it to the next level.
Right. So
may I now request Dr. Sachin Suryavanshi to highlight this.
yes, sure. So what we are doing and what we should do, and I would like to first refer to your comments. Are we driven by technology or are we driving? There can't be human element can't be removed from the technology, right? There should always be clinical decision support that should be there at the end of whatever technology is giving us. Europeans have made legislation in which they have made it compulsory that there should be clinical decision support, and they have also protected the rights of the patients. Now I'll just give you example what we are doing and what we should do, what we should drive. So in India there is lot of scope of using and applying this technology to improve the outcomes. I give you my example at my company. Somebody was speaking about the stroke in the morning. So we are getting about 1.25 million cases of stroke per year, and can you imagine just 1% of the patients are getting treatment or are getting right treatment within a window period of 4.5 hours. Can we improve it? We can improve it. So we are also working with a startup to spread the awareness about the symptoms, to spread the awareness about where to go once you have symptoms, once you have identified, and educate the doctors to give him the right injection within 4.5 hours, so as to improve the mortality and morbidity. So this is what the pharmaceutical companies are doing. They are driving, but at the same time, I must mention, they are not driven, or anybody should not be driven by the technology. There should always be human touch and clinical decision support should be there. So we are engaging in different type of such activities wherein we are driving technology to improve the patient outcomes. I just give you one example, but there are many programs that are being driven.
Thank you. Mr. Surajit Mukherjee, what would you like to add to it?
Sure,
please?
sure. Completely agreed. I completely agree with my fellow panelists. So let me give you a different perspective from a doctor's world perspective. 2019, there was this big conference happening at Chicago, Radiological Society of North America annual meeting. That's the largest international meeting of radiologists, where you have some 18,000 radiologists from all across the world, assembling. So those were relatively early days of AI creeping into radiology, and you might be knowing that radiology was one of those specialties that first saw the implementation of AI. The question was, and a lot of doctors, radiologists were very kind of perturbed, will AI replace me? As in, will AI replace me as a radiologist? If it is going to do all the reporting, all the reading, analyzing of my CT, MRI, et cetera, where will my requirement be tomorrow? So they had an official debate on this. Will AI replace radiologists? It was a very animated, heated kind of a debate. And I was very lucky to be present there and hear them out. And these were like demigods of radiology, discussing. So after the discussion, the consensus was AI will not replace radiologists, that's for sure, but radiologists who implement AI in their practice will replace radiologists who do not implement AI. So that kind of tells you, that's a very, very profound, seminal kind of a statement that tells you, from the medical world perspective, what were the fears? There are currently still fears, but then, things are opening up much, much more. Coming to the second bit, COVID taught us more about, preventive healthcare. We all knew, एक annual health checkup होता है, वो सब है, but how many of us really went and did it? But post-COVID, there was a sea change, in approach. And we suddenly realized, when we unfortunately saw the loss of near and dear ones, we realized that, hey, preventive healthcare is important. I think that's one place where technology, has a huge role to play. Whenever we talk of wearables, etc., that falls largely under the preventive space also. Like, we were talking about the continuous CGM, the continuous glucose monitoring device. It kind of tells you, what are the spikes happening, throughout the day, and what, what are your lifestyle routines that you might need to tweak in order to ensure that things are under control, and therefore, you don't have an episode later, in the future. Similarly with cardiac. Just on a lighter side, there's this very famous cosmetic company, I won't name that, international company, that now has a wearable sensor. It's a cosmetics company. It has now come out with a wearable sensor that actually tells the lady who's wearing it what's the dosage of UV she's exposed to. What is the dosage of pollen she's exposed to, pollution, and also sleep, aka beauty sleep. So that's technology, for you. Yeah, thanks.
I just need to add a couple of points. AI means everywhere we are afraid of it, but it's like garbage in, garbage out. You need a human brain to interpret the data as well, and you need to give the right information so that AI can help you. What AI does is help us reduce time and help us everything in real time. That's what AI is. Like when we started with computers, everybody was saying that computers will replace jobs. There are more jobs. There is laptop at everybody. In fact, now computer work is done on mobile as well. So AI, you have to adopt them to be more best at what you do, but they will never replace you. There is one more thing, I think, since there are patients here or patient groups here, I would say one more important part for us to grow further our future is coming up and talking about what's happening. For example, all the pharma industry, we have something called as a department called as safety department or a pharmacovigilance department, where you report your symptoms, what happens after you take drugs. Okay, what we have seen, and we were discussing in the last conference, pharmacovigilance conference, maximum reporting in India comes from rural population. Okay, metros, Mumbai or something like that. Hardly we ever report that after I took this medication I had acidity, or after I took this medication I had a headache, or I felt something else. And that will actually help AI to predict that if this medication is taken, this is what happens. Okay, so it's actually that part that even patients or we as consumers should also adopt AI to give more and more information so that AI can predict what will happen to us and how our future will be. So it's not only responsibility of government or pharmaceutical industry, but also patient themselves to come forward and tell us what's happening to them so that we can gather that information and predict. So that's precision medicine or precision diagnostic.
Thank you very much. I think it's time now we open up the session to question answers, and maybe request the audience to come up with questions which are relevant. If you would like to name as to whom specifically it's being addressed, that will be good. Otherwise, the panel will decide as to who should answer the question.
Hi, good afternoon, everyone. I'm Dr. Ruchi Mehta. So I come from a background where I've worked extensively as a hospital administrator and currently working in the digital health innovation segments. And I'm a clinical provider as well. I would like to target this question to Dr. Saurabh or Dr. Mukherjee, like whoever would want to take it. Like you very strongly suggested 2 points, affordability and trust. So my question is about trust. And you essentially mentioned that, we have to educate everyone. I'm sure everyone out here knows that technology is the way forward. We are all on the same page. But what are we really doing beyond education to make sure that there's enough framework in place which is guiding all the tech companies, probably working with the central government in developing those standards. Right now, it's probably just the IT Act, which is relevant in India, whereas you have GDPR, you have HIPAA standards and all of those, but they're not mandated out here in India, right? You'll have probably a few ISO certifications to go forward to. You'll have a few guidelines, like say telemedicine practice guidelines. But what can we really do to have a robust compliance framework in place to really augment the trust factor? Because education is something which is probably going to help you. But how do we really say with 100% conviction that yes, whatever technology or products or services that I'm building using technology are absolutely safe for my patients, not just for my patients or users, but even my stakeholders, because here my stakeholders are hospitals, my stakeholders are laboratories, my stakeholders are biomedical companies, healthcare insurance sectors, all of those, right? So how much of pharma companies, I would say, collaborating with policymakers to bring in that entire framework in place, which makes our technology, I would say, more hole-proof, more trustworthy, and more evidence-based?
Thank you for the question, and I'll take that as a starting, and then I'll request my fellow colleagues to talk about it. And I think that's a brilliant question, first of all, so thank you for bringing that up. And my apologies, we missed talking about it. So regarding trust, what pharma industries are doing. So let me tell you this way. We are doing a lot, and we are doing a lot at multiple factors. Let me start first with policymakers, and then I'll touch a little bit about what we are doing with Government of India. And it's not just we, I'm talking in terms of all pharmaceutical fraternity. So first thing what we are trying to do is we are trying to understand the policies which are done in the West. Okay, because in West, first of all is they have less population, they have controllable population, and they have controllable guidelines which can be done. And most importantly, the audience there are receptive to their government. Okay, the best example is take Singapore. We always talk about Singapore, Japan, so let's take Singapore. Singapore is lesser than Mumbai. And when this thing about COVID happened, you saw they created a bubble. Nobody coming out, nobody going out, nobody coming in. And Singapore was the best bubble. There was something created as New Zealand and Australia bubble as well, which got burst. But Singapore was the best one where people were still roaming on the roads during COVID time for the most of the time. They created that bubble because patients were receptive, general population was receptive, and everything was technology driven. At the other end, we at India, we were also trusting Arogya Setu app. Okay, so the first thing what we are trying to do with government is understanding the European and the US population, how they are, understanding their policies, and trying to adopt them to the Indian population. That adoption is taking time, and it will take time. Because most importantly is that we have to understand that how our mentality is, how our culture is, and how to make it more affordable, accessible, even to the lowest, we usually call weakest of the link, a person who less understands technology, a person who less understands but wants to trust. So how to make those policy changes, that's first thing with policymakers. Second thing, we as pharmaceutical company are working with various physicians to build that trust. Okay, the best example what we are trying to do is right now is India is the only country where we have hospital chains. You take a name and there are hospital chains distributed all across India. Imagine if these hospital chains come together and say that this is what what we follow. This is the predictive AI, or this is the apps which we follow, or this is the technology which we follow, and then patients are following that, or patients are applying to that. Because if you see a big name, a big brand name associated, a hospital chain associated with it, it will help us down. So we are trying to work with hospital chains, we are trying to work with physicians to take that and build that trust around it. When these two things are happening, there are small startups with which we are working, and there are also big names which we are working. It's just that permutation combination which we are trying to do, and that is taking time, because when a name is associated with any part, there are lots of questions which are raised about it. Let me give the best example in US. Okay, when they were talking about we have the COVID vaccination, there was a company's logo in front of there. Everybody challenging, saying that, oh, this is a company-driven agenda. A company is trying to put their vaccines around it. So what happens is a trust has to be built also when there is a pharmaceutical name associated with it. So the best thing what pharma industries are doing is they are staying at the backstage. We are not bringing our name forward. We are just saying that let the government, let the policymaker, let the hospital chains take it ahead. We are happy to stay back, because that is how then the trust will be built. And once the trust is built, at the end of the day, we all want everybody to be healthy living. So that's in a nutshell what we are trying to do. I hope I'm able to answer your question, but I'll ask my fellow panelists.
I think we are short of time now.
Okay. Yeah. Hello. So excellent question. So I'll just very quickly share some anecdotes from the field perspective, on the ground perspective. See, as compared to maybe 4 or 5 years back to today, maybe last 1 or 2 years, whenever we are having discussions, say with a government entity, right, a National Health Mission or whoever, one of the questions that come up and they really grill us on is data privacy, patient data privacy. Now that question was not there 3 or 4 years back, but we're seeing that coming up again and again and again. So that kind of tells us that, hey, this is being taken cognizance of, number one. Number two, when it comes to the private sector, for example, he just mentioned about, hospital chains. So when we talk to hospital chains, there are now CIOs and CTOs involved in the discussions, because they understand that it's just not a pure clinical, there's also a lot of technology and the data privacy aspect also coming in. And at times they also say, while your solution is hosted on the cloud, can you actually set up servers on premise? Because again, while you are Euro GDPR and HIPAA compliant, but still from our protocol perspective, that kind of tells us that they've also set up their internal protocols. So we are moving, so there is cognizance of that. We're moving in the right direction. Of course, there's a lot much to cover.
Sir, I'll just comment quickly further to your question. I'm Dr. Devashish. I work very closely with Government of India. I sit with BIRAC. I am a technical expert for all the startups, especially medtech startups. I'm doing for last 7 years. So what questions you asked? Now the whole buzz is AI and ML, correct? To be very frank, even in the West, they don't have good regulations. Everybody is learning. Everyone is learning. Even US invited Google and Microsoft to help them to make regulations. So it's happening very slowly. As clinicians, clinical stuff, we are all clinicians, we go little slow. Innovation is happening so fast. Every day you have a new app. When I see when I see people coming to this for funding to government, they don't understand AI ML, because they just say, oh, it's AI ML, but as he said, for AI ML you need data. Data is key. If you do not have quality data, it's garbage. And in India, the challenge is the healthcare data is not freely available like in US. So to develop a good AI tool in India, Surjit will agree, it's very, very challenging. You need to actually partner with a good hospital, large hospital, because you can't just make an AI tool, a machine learning. You need good data, quality and quantity data. Coming to your questions of ethics, regulations, still we are in very, very early stage. Everybody is learning, everyone. So it will take time. What we ask, especially firms who develop, we tell them, just tell that, don't just tell you can do everything. You have to be transparent to get the trust. You can tell, okay, my AI tool can give this, cannot give this. You have to, but challenge here is, they say, I can do everything. That is the problem here. So that's why you have to be really, when as a consumer, I'm telling as a consumer, when somebody tells you, okay, this is an AI tool, you need to really look at it. If it is the AI, what machine learning
Okay, I think I'll have to intervene to cut short because we are short of time.
No, I'll just close it.
Yeah.
That you need to be careful how they're developing it, and I think with time we'll all learn together. Thank you.
So we'll close the session here. I thank all the audience for the very patient hearing as also the active involvement in the discussion. And I thank the panelists for the wonderful elucidation of the theme at hand and also the sub-theme at hand. Thank you very much. Thank you all.
Thank you so much for your insights. Now I request Kamal sir to come on stage to felicitate the panelists. Mr. Sujit Mukherjee. Dr. Sachin Suryavanshi. Dr. Saurabh. Colonel Rajiv Manali. I request you all for a group photograph. Thank you. We are setting the stage now. Just give us 2 minutes. I just wanted to announce someone has left his phone. I don't know whose phone is this. Okay. Up next, we have a spotlight session that explores the critical intersection of healthcare and nutrition. Revolutionizing healthcare nutrition, proper nutrition is the cornerstone of better health outcomes, and innovative approach are essential to address the evolving needs of patients and caregivers. To lead this insightful session, we are privileged to have Mr. Subrata Gupta, Chief Strategy and Transformation Officer at Compass Group India. With his expertise in driving strategic innovation, Mr. Gupta will shed light on how healthcare nutrition is being transformed to improve lives. Please join me in welcoming Mr. Subrata Gupta to the stage. Please put your hands together. Over to you, sir. The stage is yours.
Thank you so much. In fact, maybe I can speak
The theme of this event is patient centricity and having a patient-first approach to care. And I think what I wanted to do was to take maybe about 15 odd minutes to talk about one dimension of patient centricity and care that is usually does not come to the forefront. And that is the role that nutrition can play in creating greater patient centricity and care. So, but before I go there, let me first introduce Compass Group. Compass Group is the largest food and facilities management provider in the world. We ended last year at about $42 billion in terms of revenue. We operate across 33 countries, and we serve 5.5 billion meals every year. And we are very, very proud of our client roster. We count most of the world's leading brands as clients. In fact, 96 of the Fortune 100 clients, companies, are Compass clients and have been our clients for a long time. We've been in India for about 15 years. We are one of the largest food and facilities services providers in India. We have more than 800 client locations, more than 11 lakh meals every day across all the sectors, and we have about 40,000 people working in the company today. We do a lot of work in the healthcare sector in India. We have more than 25 large leading private sector hospitals as clients, and we serve more than 1 crore meals every year in these hospitals across all the meal programs that we run. Globally, healthcare is one of the largest sectors for Compass Group. So we are present across 12 countries, 3,500 clinics and hospitals, 2.1 million, 21 lakh meals served. And we are really proud to be associated with one of the largest, most of the largest and the best hospitals across the world, including in US and in Europe. For example, the Mayo Clinic in US or the NHS group of hospitals in the UK. So before I get into the core of the presentation in terms of the role of nutrition, I wanted to take a little bit of time and set some context. So if you see where the healthcare provider landscape is today, where the healthcare industry is today, there are a couple of key dimensions that are at play. The first is the changing nature of the patient. So I think in the panel right before this, there was a lot of conversation around people being more aware, wearables, a lot of data coming in. So if you see the patient who today, there is a much higher degree of awareness around health and well-being, the role that food plays in that journey, and because of availability of all of these wearables and health tech, etc., along with dietitians, nutritionists, and an entire ecosystem that has been created to support this, there is generally a very strong conscious desire to take control of one's health and well-being, and a very clear understanding of at least the role nutrition plays in that. So India continues to be a major destination for healthcare tourism. I think last year we did about $5 billion worth of revenue from medical tourism or international patients coming into India, about I think 5 or 6 lakh patients coming in every year. And what this means for healthcare providers is there needs to be a clear understanding of the dietary needs, preferences of this large cohort of patients who are coming in from other countries. So India is a massively underserved country in terms of population to doctor ratio. What this means for most cases is doctors are extremely overstretched, and they work extremely hard to be able to support and provide good quality care within a hospital setting, given this adverse ratio. And finally, I think if you look at what is happening in the healthcare sector, is a lot of private investments coming in, PE, VC money coming in, a lot of M&A. And what this capital flow essentially does is it's going to help in building infrastructure. But the downside of that is there is increased competition, and there is an increased need from healthcare providers to be able to differentiate themselves given the high density of supply in the most affluent or the major pin codes across the top cities in the country. So essentially what we're saying is that in the healthcare sector, there is a conversation that needs to happen and an evolution that needs to happen. And if you look at different parts of the hospital, for example, if you look at what is happening in diagnostics and in surgery, I think there were a couple of conversations in the previous panel session. There is completely revolutionized the quality of the diagnostic machines, the quality of the output, the sophistication of robotic surgeries today is unmatched, and there has been a tremendous amount of evolution over the last couple of decades. If you look at what has happened to the data backbone of hospitals, so along with this improvement in the lab, in the diagnostics, in surgery, what has happened in the data backbone is through EMRs, through the hospital information systems that are now prevalent, there's a very large amount of patient data that hospitals are able to, diagnostic data that hospitals are able to analyze and create a personalized approach towards care. So there has been, across all of these areas, a very, very large set of innovations and improvements that has happened over the last couple of decades. But what has happened in nutrition? Hand on heart, if you were to look at today, the type of food, thalis for the most part, that is served to patients is pretty much the same as it was being served 10 or 15 years ago. And this is when tremendous advances have been made in the back end in terms of understanding the link between nutrition and health and wellness. A lot of hospitals, even today, look at food as just as a cost. They do not see it as value. They do not understand today or do not fully appreciate the value that a scientifically designed food program can bring to patients, to doctors, etc., so on and so forth. So essentially, our submission is that there is an evolution that we can partner on that needs to happen in bringing high-quality nutrition, scientifically designed food programs within a hospital setting. And that is really the journey that we are going to talk about today. If you look at the data, so it's not only about this, making this as a general statement. If you look at research around the world, there is a tremendous amount of data available. For example, the National Library of Medicine Archives from the US, that today this is a problem that is getting increasingly recognized. 64% patients express dissatisfaction with the quality of the hospital food that they are served. The well-being of physicians work extremely long hours. They do not get the right kind of nutrition that they need to get to be able to stay alert and stay productive. There could be a 16% reduction in healthcare cost, associated cost, if the patients were to receive meals that are specifically designed keeping their needs in mind. So there is a lot of research data that backs the point of view that a more scientifically enabled food program for all stakeholders would be of tremendous value in terms of driving a differentiation within a hospital setting. So food is very important to everyone. It's a part of our culture. It's part of who we are. You may not have a point of view on anything in this world, but you will have a point of view on food. So it's very central to who we are and how we identify ourselves. And this food within a hospital setting needs to cater to the needs of multiple stakeholders. Of course, the patients, it has to be designed keeping their physiological needs and the procedures that they are in the hospital for, maybe underlying disease conditions, maybe age, etc., so on and so forth. So it has to be scientifically designed, keeping their specific needs in mind, so that it can aid well-being and health and better outcomes. For doctors and healthcare workers, this is all about having the right nutrition so that they are able to focus on their job, for the energy, reduction of stress, productivity, etc., so on and so forth. And for visitors, it's a fairly stressful environment. I mean, any hospital there's loved ones are in the hospital, admitted in the hospital. So what they need is comforting food that allows them to, kind of mitigates that stress and allows them to engage productively while they are there. So essentially what we are saying is that there is a need to redefine how hospital food programs are defined and how they are executed to be able to deliver substantially higher value that can allow hospitals to differentiate themselves and drive better patient experience and patient satisfaction. And for us, this framework is fundamentally based on three things. The first is delivering tasty nutrition. We've been talking about scientifically designed food programs, what we have done at Compass is we have spent the last couple of years consolidating research and data to identify the macro and micronutrients for every dish that we serve within the healthcare sector. So we are able to connect that data to underlying disease conditions, patient requirements, and we are able to create very, very personalized meal programs that we can serve to the IPD patients and to other stakeholders within the hospital. And a lot of this science is now being captured in our nutritional guidance app meant for the dietitians that we are going to demonstrate later in the presentation. The second one is the experience of food. So if you look at the patient's mind state, when they come into the hospital, they are frustrated, they are anxious, they are depressed. There is usually the question, why did this happen to me and what is going to happen to me? They are lonely, all of those emotions are playing in their head. And our point of view is, food can create a comforting and nourishing experience, a welcoming experience, while patients are there in the hospital. Of course, within the dietary restrictions, etc., that needs to be taken care of. But the right food program, the right variety can create a far more enriched experience than what patients are going through today. And finally, within a hospital setting, of course, the right patient, the right food, right time, right temperature is very important. So the third aspect of the food program that we offered in the healthcare sector is essentially focused on service standards and service excellence that allows hospitals to run food programs in alignment with frameworks such as JCI, NABH, etc. So what does this do in terms of outcome? So we talked about a food program that takes care of nutritional needs for patients and all stakeholders, that creates a much better experience, and it is backed by very strong operating standards and safety frameworks. What it does for all the stakeholders is, for patients, it serves the food that they really need, and the food that is going to create the best outcome for them, the best health outcome for them, drive the maximum wellness for them. For doctors and medical staff providers, it's about giving them the nourishment that they require so that they can stay energized, they can stay attentive, reduce stress, have the right food at the right point in time. And for visitors, it's about ensuring that they have the right variety, comforting food, nourishing food that allows them to be in a different or a better state of mind while they are inside the hospital. So earlier in the presentation, we talked about the nutritional guidance app. So what I wanted to do here was to show a short video which will give you a sense of what this app is all about.
In a hospital, every meal served is not just food. It's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
Thank you. So what this app does, this app is directed towards dietitians. If you look at any hospital today, dietitians spend about 40% of their time in the back office trying to just work data. And a lot of this data is not really central. It is in the laptops of the dietitian, might be sourced from different places. Every time the doctor recommends a change in the menu, they scramble to collect that new information and process it so that it is within the nutritional guidelines that needs to be, for that particular patient. This app eliminates all of that. So we have, like I mentioned, we have micro data for thousands and thousands of recipes that we serve in the healthcare sector. And all of these are, in the initial setup process, integrated into the diet slip and the diet management system, so that for a dietitian, designing a menu that is very specific for a patient is extremely easy. Making changes to that menu is extremely easy. Understanding the impact of the change from a micro standpoint, from the DRI standpoint of the patient, becomes extremely simple. So this, we believe, is a very, very powerful tool, and we have launched this across multiple hospitals in India with incredibly good feedback from the dietitian staff. So moving ahead, just to kind of start to wrap this up, I think there is an incredible journey that we can take together. And we believe that there is a massive unmet need in terms of the right food programs being deployed in hospitals, so that the overall experience of patients, satisfaction of patients, doctors, nurses, healthcare workers, visitors, moves to a completely different level. We are very clear we are not doctors, but we have a very strong point of view on food, and we understand food better than anybody else. And our emphasis is that we want to partner with healthcare providers to be able to design and implement these food programs so that their patients and their healthcare staff and doctors are much better from a wellness, from a nourishment, from an overall health outcome standpoint. They're in a far better shape than they are today. And this particular aspect of the hospital is also able to evolve the way other departments within the hospital have evolved over time. So just to give you guys a sneak peek, there's a food program set up outside that is serving a couple of dishes that we serve specifically in the MediRest sector. And we would love for you guys to eat and share your feedback. There's some amazing stuff there. And Compass India, we start our business, we drive our business based on a sense of purpose. Why do we exist? We exist to shape a happier, healthier, and a more sustainable world. And I believe in the healthcare sector, we can be true partners for providers to be able to make this huge leap and drive better outcomes and satisfaction. Thank you.
Thank you so much for sharing your knowledge with us. I request Mr. Kamal sir to come on stage and felicitate Mr. Subroto Gupta. Please put your hands together. Thank you all for your active participation so far. We now break for networking lunch and kindly request everyone to return to the hall by 2:15 p.m. as we resume with our next session. Thank you. Enjoy.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations. In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं छिटी जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीरा। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives, harnessing the power of social media, the Council impacts over 100 million lives annually.
1, 2, check. Hello. Hey. Hey, hey, hey. 1, 2, check. Hello. Check test. 1, 2, check. Hey. Hey, hey, hey. 1, 2, check. Check. Hello. Hello. Check test. 1, 2, check. Hey. Hey, hey, hey. 1, 2, check. Test. Hello. Check. 1, check. Check test. Hello. Check. Check. Hey. Hey, hey, hey. 1, 2, check. Check. 1, 2, check test. Hello. check, hey, 1, 2. Huh? Hello, hello, check, 1, 2, 2, hello, check, test, hello, check, hey, 1, 2, check, hello, hey, check, hello, check, hello, hello, 1, 2, check, hello, hey, 1, 2. Hey, 1, 2, check, hello, check, test, hello, check, hey, 1, 2, check, test, hello, 1, 2, check, test, hello, check, 1, 2, 1. Hello, check, test, hello, check, hello, 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 hello. Hello, check, hello, 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 check, 1, 2, check, test, hello, check, hey, 1, 2, check, test, hello, check, hey. check, check, hello, 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 check, hey, check test, hello, check, check, hey, 1, 2, check, hello, hello. Check, check, hello, hello, check, check test, hey, 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 1, 2, check, hello, check, check, hey, 1, 2, check, check test, hello, check, check, 1. Check. Check, 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 hey, 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 1, 2, check. सोड बंद कर रिले बंद कर hey, 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 1, 2, check, check test. तुम्हारा होगा क्या है साइड माई -10 dB 0 dB check, check, hey, 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 1, 2, check, check, check test. Hello, hello, check, check, 1, 2, check, hey, 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 1, 2, check test. Hello, check, check, 1, 2, check, hey, hey, hi, 1, hey, hi, check, 1, 2, check, hey, 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 check, hello, hello, check, 1, 2, check test. Hello, check, hey, 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 1, 2, 1, check, test, hello, hello, check, hey, hello, hello, check, check, test, hello, check, hey, 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 1, 1, check, check, hello, hello, check, check test, 1, 2, 2, check, hey, 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 1, 2, check test, hello, hello, check, hey, hey, 1, 2, check test, hello, check, hey, 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 1, 1, 2, check, check test, hello, 1, 2, check, hello, check, check, 1, 2, check test, hey, 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 1, 2, check, check test. Hello, check. Hey, hey, 1, 2, check, check test. Hello, check, check, 1, 2, check. Hey, 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 1, 2. Arfan, okay?
patient's journey to recovery. by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है। कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीरा। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives, harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the consolidated daily reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है। कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर उन्हें पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी
Thank you for joining us. We are starting our summit in next 2 minutes.
तत्व का जिससे ये शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका
Let's continue our summit. Our next topic for panel discussion is, I'm sorry, we are just setting down the screen. Our next topic for panel discussion is digital health innovations and their impact on patient engagement. We will explore the transformative impact of digital health technologies. For the discussion, I would like to invite on stage our esteemed panelists, Mr. Lilin, partner Cyril Amarchand Mangaldas, Mr. Rajesh Bose, Director Programs and Partnerships, Curai, Mr. Ashish, AVP Digital Marketing and E-Commerce Microlabs Limited. Guiding this insightful discussion is our esteemed moderator, Professor Vivek, Independent Director, Entote Pharmaceuticals, a former director at OPPI with 25 years at GSK. Professor Vivek has been instrumental in projects such as the Routry OPPI pilot project to reduce maternal mortality. He is visiting faculty members at top management institutes, and he has been recognized with awards for his academic and professional contributions. Without further ado, let's begin the conversation. Over to you, sir. Yes. All set, sir.
At the outset, let me thank IHW Council Summit organizers for allowing me to contribute for this brilliant panel discussion on digital health innovation and impact on patient engagement. It's my privilege first to introduce to you my fellow panelists who have taken their time out to contribute for this panel discussion. Mr. Rajesh Bose, he is the Director of Program and Penetration at QRAI. The QRAI is a company that has the power of artificial intelligence to revolutionize healthcare delivery worldwide. Rajesh is a distinguished public health professional with Masters in Public Health from Tata Institute of Social Sciences. He has contributed significantly to the healthcare landscape through his strategic leadership and project management, overseeing initiatives across India and Asia Pacific region. Prior to QRAI, Rajesh has held various key positions at PATH, PATH, NextLift, Tata Trust, and National Health Authority.
Rajesh is deeply passionate about convergence of technology and healthcare with a focus on health technology, AI-driven healthcare initiatives, and digital health and RWE studies. I welcome Rajesh. Please give him a big hand. Now I introduce Biplab Lenin. Biplab is working with Cyril Amarchand Mangaldas, India's leading full-fledged law firm company. Biplab is a legal professional with over 12 years of diverse experience, spanning law firms as well as corporate roles in all areas of life sciences and intellectual property and regulatory compliance. He has an extensive expertise in navigating complex regulatory framework for pharma and medical device organizations, handling high-value transactions and supporting industry-defined litigations. An alumnus of IIT Kharagpur Law School, he writes and speaks on topics related to digital health and emerging technologies on healthcare. Biplab has been named among India's top 100 A-list lawyers by Indian Business Law Journal and receiving multiple rewards and recognitions from Legal 500 Asia Pacific, including Next Generation Partner and nomination for Life Science and Healthcare Lawyer of the Year. Please put your hands together to welcome Rajesh Biplab. Now I introduce Ashish Alawat, AVP Marketing and Commerce and E-commerce from Microlab. Perhaps many of you will know that Microlab is a company which is a manufacturer of Dolo paracetamol, which has contributed significantly during COVID time. Ashish is a digital transformation leader with a close to decade experience in healthcare, health tech, and pharma industry. He has helped over 250 prescription and OTC brands redesign their multi-channel marketing effort, thereby enhancing their life cycle and achieve better outcome and ROI. He has also built and managed high-performance teams and delivered results. Ashish is an emerging pharma leader awardee 2024 and Digital Prophet. May I request you to give a big hand? So, in the panel, you have got almost 75 years of experience in healthcare, which we'll be trying to give it to you in next 45 minutes time, hopefully. So let me quickly start with the World Health Organization. Topic is, patient health insights, patient engagement insights, and the healthcare innovation, digital healthcare innovation. So what WHO is the one which normally gives direction to the world about healthcare, healthcare facilities, and healthcare research. So occasionally all citizens have to make their decision which affect healthcare outcomes. In fact, what WHO says that patients play a critical role shaping healthcare and healthcare research, making informed decisions related to treatment, related to diagnosis, and related to care. All of us should be proud that India will be occupying a top position, in top 3 position in next 10 years, contributing substantially for our GDP. It will be in the first 3, top 5 position in next decade, and we'll be happy to know that every 1.5 year, $1 trillion US dollars will be added to the kitty. Technology and innovation are the drivers of any economy. India is no exception. In fact, you'll be glad to know that healthcare sector is the one where GDP growth, where the growth of healthcare is higher than the GDP. So it's having a driver's seat. So at this backdrop, if you see, there's a shift, there's an aging population, there's a fast-growing middle class, and 100 million plus elderly will be added by 2030. To this, we have support from healthcare infrastructure in terms of medical colleges, in terms of patient seats, in terms of hospital beds, and last 10 years, there has been a substantial growth in enhancing healthcare infrastructure to meet this additional demand. With this, there is a shift in the therapy, acute therapy, chronic therapy. Acute therapy today in pharma is basically giving the momentum, whereas the chronic therapy is the one which is giving you the acceleration. And with this change in profile, patient engagement strategies also need to change. Question which comes is, where do our patients lie? Normally we focus only on the urban area. Really, India lies almost around 67% in the rural area, where only 33% facilities are available. And 67% facilities are being provided into the urban area. The key question is, can this technology, can this digital innovation will cater to the need of this rural India? If you look at the overall healthcare system anywhere, there are 3 stages and there are 4 important elements. Accessing care, receiving care, and paying for the care. These are the 3 stages. And the 4 dimensions are physical reach, location, the quality of the medication, the accessibility of the medication, and the affordability. Any obstacle at any point of time will ensure that there is an obstacle which will not allow patient engagement, patient involvement. Now let me try to immediately quickly come to the digital health innovation. We have got 3 experts, 3 youngsters who will talk more. I'll try to restrict my setting the context on this. That earlier we had a traditional model where we used to work in silos, industry, academia, and HCPs, the regulators, the NGOs, the patient group, they used to work in silos. Now with this new model which is coming up, there's a multi-sector collaboration which will help to reduce time and reach the patient faster. So what could be the key principles? Purpose, there has to be a clear objective and outcome for the digital health innovation. And activity without objective is labor lost. We should be clear on the objective that we take and apply our labor accordingly. Respect, short-term success should lead to the long-term succession, otherwise it has no value. So it's important that all collaborators respect to all stakeholders. Autonomy, supporting independent decision making. Dependence, independence, and interdependence are 3 important paradigms offered to any professional. So it is important that we have a proper autonomy to work. And most important is the trust. Transparency fosters long-term partnership. Trust is an emotional glue which holds people together. So these are the basic 4 principles which need to be followed for digital health innovation. If you look at this picture, there's a patient at the center. Program is patient-centric. And the child is indicating to the doctor, look, I want to play, I want to go back to school. I don't want to take bitter medicine. Doctor is telling cohabitee mother that, look, please ensure that this medicine is shaken properly because it's suspension. Paracetamol is not available as a clear solution as of now. It's suspension. He needs to take proper dose, then only his fever will come down. Mother, cohabitee is telling a doctor that, look, ensure that the fever comes down, less medication because I have a lot of work to do. I ensure that I don't have to get up in the night to give the dose. I think what is important for the manufacturer is to pick up insight from here. This is what patient is trying to tell you, that look, I require maybe a tasty medicine. Paracetamol being bitter, the insight is, can I have some taste masking innovation? Paracetamol in suspension, can I have some innovation where I can make paracetamol in clear solution? So that is what a key insight. Many such insights could be shared. So developing patient-centric policies, gaining patients' insight into the medicines, and ensuring that relationship are focused on patient benefits are the key drivers. I'll not talk to you about technology and a lot of new innovations which will try to leave it to the panel. But let me try to talk to you about drug delivery system. NTOD has developed dynamic buffer technology, stabilized oxychlorocomplex preservative, preservative-free ionic buffer solution, vitamin D3 containing ocular lubricant drop, and there's a Pulse Pharma which has developed plyometrics technology, which is novel polymer polyol-based solubilization delivery system. So what are the key challenges? The key challenges in these digital health innovations could be fragmented healthcare delivery, key patient engagement, rising healthcare cost and inequities as we have seen rural versus urban, access to healthcare, and high out-of-pocket expenses. Look, Economist 2025 gives series of opportunities. I've captured few, which has come yesterday itself. If you really see the opportunity for digital revolution, quantitatively speaking, is larger. On the top, today you have got 83% of the 100 people will be accessing internet as compared to 57% during COVID time. That is the opportunity. Not that I want to go through each and every. Last, I would like to talk to you, the new model that government-government interaction supported by a private player, like we have Microsoft in Abu Dhabi. Similarly, we have got Saudi Arabia and Google. So the message is that size of the opportunity is large. Can we develop appropriate skills to seize this opportunity? So I think with this, let me quickly indicate to you that our objective is to ensure that we reach SDG. I think you would have seen some SDG here, so I don't want to repeat here. Sustainable Development Goal 3 aims to ensure healthy life and promote well-being. I think our objective should be reached toward that. And if you ask me, what are the resolutions that the business leader should leave at the time of this digital evolution, is engaging all stakeholders at the patient first mission. How can put patient at the heart of our organization, and structuring for success with commitment for investing in technology. So I think if you see, Satya Nadella has said some time back, we saw 2 years of digital transformation coming in 2 months. So I think time is shrinking, and I think with this quick setting the context, I would like to start a quick panel discussion. Shall I come to Rajesh first? Yeah. So, Rajesh, my first question is, can you give your thought process, based on the basic topic, so that to kickstart?
So, thank you, sir. So, talking about digital health interventions and the patient thing is that what comes to my mind is there are technologies available across the globe. There is it could be small, it could be big, but implementing this technology in the health system is the key to accessing it to the patient. Technology being available and getting it implemented in the health system, integrating it with the health system is the key. This is not a problem only with India. You take any health system across the geography, integrating it with health system has its own issues. So to take an example, I come from a company called Cure.ai. We have an AI technology to screen tuberculosis. It's a very affordable technology which can be implemented in the X-ray machines in the hospitals and screen. So technically there is a clear-cut benefit for the health system when this technology is implemented. But when you dive deep, how this implementation is going to happen, there are a lot of framework issues come into place. Starts with the regulatory framework. Every country has different regulatory frameworks to incorporate any technology into the thing. So once even after we closing the regulatory framework, then there is conceived notions, right? If any technology, AI or something is we are going to introduce it to health system, the way people, doctors, the current communities, they conceive is not something we know. It could be those concerns. Then comes the data myth. There are people there are concerns around the data privacy. So though there are certain regulations universally available, but every country has its own regulations. So this is all bureaucratic processes. It's all making very much sense, but from a implementation standpoint, this acts as a pre-barriers before the implementation. And after implementation, then it is more of adoption is the correct key. So any technology come, right? I mean, if I don't know to drive, or there's no one to drive at my home, there's no point in buying a car. Same, there should be someone in the health system or in the hospital to drive the technology, to use it. Otherwise, none of them are going to add value or bring back to the community. So the key here is, one is, we identifying the ecosystem, understanding the health system, and implementing it diligently with the support of health system and the users. So that is what I think the foundation of it.
Very nice, very nice. I think take-home message is that implementation or the execution is the key. I think the execution is a problem right from boardroom to bathroom, everywhere. That's a key thing. Another important aspect which you made, is technology. I think investing in technology is a must. Technology will make itself obsolete faster. So if I don't invest in today's technology, I'm not ready for tomorrow. Thank you so much, Rajesh, for a very thoughtful point that you have given. May I now request Biplab to give your value add from first commercial perspective, then legal perspective, because you are wearing two hats.
Thank you so much. So the way I look at it is that digital health means integration of technology, as you said. Even if it is a simpler form to make a doctor's appointment, or artificial intelligence or machine learning, or it could be a robotic surgery. Everything is considered as digital health, because conventionally, the way we work is that as a patient, we need to go to the doctor physically, move from our place to the doctor's place. The doctor will give us the prescription. We'll take that prescription to a pharmacy, or if it requires a diagnosis to be carried out, then we'll go to the diagnostic center, we'll wait for some time, and once the process is done, we'll go to the pharmacy and get the medicines. The way it has transformed, at least over the last 5 years, and COVID-19 is the proof that if the entire world shuts,
the delivery of medicines or the healthcare practice can touch everyone's life. And this is the only sector which touches everyone's life. And if you look at least in tier 1 cities which are concerned, an individual need not to move outside his place to consult a doctor today, to get the diagnostic done at his premise or her premise, or get the medicines done. So that is the power of digital health. Though of course, from a legal perspective, there are challenges because the subject matter is highly regulated, and the law, the regulations, the rules have not been tweaked to that context. The best example would be e-pharmacy. It is not a new concept. It started back in 2015, where people started delivering medicines online. Even though in physical delivery of medicines, the prescriptions which are not being checked regularly by the pharmacy holders, but in e-pharmacy at least we have records maintained by the e-pharmacy wherein a person is delivering or dispensing the medicine. But the challenge is that who will ensure that the medicine which reaches to the consumer are not spurious or are not misbranded. So there are of course the challenges with the digital health, but in 2024, we are living in digital India. So we are at the cusp of digital health revolution, and we believe every sector in digital health, because it is not one concept, there are different sectors which are integrating. So now we have more than 10,000 startups or tech-based companies who are providing assistance to the healthcare or pharmaceutical providers. And now pharmaceutical company or healthcare providers also have started integrating their or creating their own tech. So I believe digital health is something which is going to grow leaps and bounds in the future.
Thank you so much, Biplab. In fact, you have talked about a value chain right from patient till doctor and come back, and you also talked about the power of digital health. I must also tell you that e-pharmacy started in 2015. I do not know to what extent, but I think most players in e-pharmacy are not making commercial viable proposition. At the same time, the e-pharmacy, there are no proper the notifications or the orders with reference to e-pharmacy. E-pharmacy draft rules continue to be there. They are in draft condition. I think there is a need from a government angle to ensure that the proper direction is given. Thank you so much, Biplab. Quickly you indicated. Ashish, you have been expert in pharmaceutical. I didn't cover many of my slides, giving you an opportunity. Can you give your thought on digital transformation, particularly in pharma and OTC?
Yeah, good afternoon everybody, and it's a pleasure to share the stage with Professor Vivek and other dignitaries over here, and I think it's a great initiative that IHW has taken to get all the industry leaders under one roof. Just to set a little bit of context from this question, Professor Vivek, like everybody over here has mentioned that healthcare value chains are very complex in nature. Globally, everyone knows this, and in India they are even further more complex because we have to deal with a lot more diverse and a population which is very high in density. So the value chain becomes more complex, right? And like Mr. Biplab also mentioned, you also mentioned that there is a need of kind of streamlining the entire value chain. So pharma can play a critical role in streamlining that value chain, as it is one of the core pillars of the healthcare ecosystem in India. And just to shed some light on the part of e-commerce. So I have come from an e-commerce background as well. You mentioned that all the e-pharmacies in India are not profitable. They are not making profit. The reason lies in the slides that you showed us. You said that 63% of the market in India is for acute, and only 39% is chronic, right? So e-pharmacies were technically operating only in that 39% market, which is the chronic market, where the drugs are of higher value. And when these pharmacies, they offer a big discount, and then the people buy it. Acute medicines were not being tapped into, because acute medicine is something you have a problem, you want the solution right now, right here, right? So when the doctor gives you a prescription, you just go to the nearest chemist, buy it. But having said that, how this will be transformed is now all the e-pharmacies are coming up with a quick com model. So now these e-pharmacies will be tapping into this 62% untapped acute market, wherein if you today have a fever, you can get a Dolo 6 15 minutes by these e-pharmacies, right, which are now coming into quick commerce, and we all know quick commerce is growing exponentially. So this is to answer that question. And yes, pharma again does have a critical role to play over here. Like if I give you an example of micro labs, it's in our core values that, like, patient has to be at the center of whatever we do, right? So just to take it forward, all the pharma firms are now transitioning from a product-focused offering to a service-focused offering. So many pharma firms are offering patient support programs for their products, at least for the chronic therapies and high-value products, they are doing it, right? So this is one thing which pharma companies have started to do. Also, a lot of pharma firms are now into the space of patient education and patient awareness, where they are raising awareness around the disease condition of a patient. If I give a micro labs example, because I represent micro labs, it is a campaign called Salt Satyagrah, which we recently launched, wherein we are telling people how salt is playing a major role in hypertension. WHO guideline says that 5 milligram per day should be the ideal limit, and India consumes 12 milligram per day. And in eastern side of India, it's even higher. So patient education initiatives like this are being driven by pharma firms. Then last month itself, we did something called as Mission Organ Protection, which is a diabetes team of ours linked how diabetes is impacting different organs in the body. It was to 14th November is the World Diabetes Day, so we celebrated that thing. And many other pharma firms are also doing excellent job in this particular space as well. Also, a lot of pharma firms are stepping up their game in terms of early diagnosis, where they are hosting some kind of technology-driven, I would say, diagnosis for certain kind of diseases, right? So these are the few places where pharma firms are already playing a critical role and helping this, digital transformation of the entire value chain.
I just want to add one point.
Sure.
Yeah. So, it's the health ecosystem, right? The whole healthcare ecosystem is owned by everyone. So hand-in-hand coordination is much needed. So we work with a lot of farmers. So what we do is, we are a tech company. So we don't have something that farmers has, that is access to last mile, both with the hospitals, also with the communities. So they have a wide network starting with their ground level MR. They have a very brilliant access across the country, across the globe. So we work with AstraZeneca because we have a technology to screen lung cancer, and AstraZeneca has a direct to treat lung cancer. So we have joined hands, right? So that way we work with different pharma companies. And I think that is the way out. So identifying the correct partnerships and collaborating and proliferating those partnerships for a cause, for a purpose, and getting that support to grow this partnership from the health system, including government and other stakeholders. And then, once we create that framework, then it would be more easy for people to increase the patient access to it, more patient to get beneficiaries of it. So we have to have those real world success stories of patients getting benefits from these technologies or these things. Then those comes, then gradually things would be it would be more visible, more explicit. There would be more proactive effort from governments and the other organizations like WHO. More frameworks will come, how this can directly increase patient engagement.
Very nice, Rajesh. In fact, Ashish, you have spoken very important point. The complexity is here to stay. How a professional changes this complexity into simple thing requires a lot of innovative steps and a lot of invention. You also talked about the chronic market. Let me also tell you that in Indian pharma, anybody comes from the different countries and he studies the pharma in the world, he gets dazzled. He doesn't understand what's happening in the country. We have so much of fragmentation. We have over 60,000 brands. We have almost 1.5 to 2 crore SKUs. It's mind-boggling to manage such supply chain. And as Ashish has indicated, paracetamol, there must be more than 500 brands of paracetamol. And let me tell you, I'm working in the area of pricing. Majority of the companies are not having a financial proposition for paracetamol because it's price controlled. If they decide not to sell, we'll have serious problem of getting temperature under control. But as he said rightly that, it's patient first, not the profit first, which is driving right from the small company till the big company. I must tell you, Dolo is also not making any great profit. Now maybe last 1 year could have been a little better off. But definitely many companies, it's a patient first and not a profit first. Thank you so much. Now let me come to Biplab. Biplab, can you throw your light on the current landscape on digital health as you see? I dropped many of my slides thinking that you people will speak on that.
Sure, sir. So the way, as a lawyer, I see to it, I have been advising good number of companies in the e-pharmacy space, telemedicine space, practice of medicine space, health and wellness space, diagnostic and digital therapeutic space, health IoT and artificial intelligence and machine learning. So over the last 5 years, what I have seen is that there were companies which, during COVID, which started as a telemedicine company. There were companies who were only doing e-pharmacy. There were companies who are doing only diagnostics. So what now the scenario has changed is that majority big companies wants to have an omni-channel. They do not want you to go outside of their ecosystem which they have built, which would mean is that that company has access to the doctor's consultation and has access to the diagnostic labs wherein you could book and you could avail their services. And they also have started delivery of medicines wherein they do have physical premises wherein they are delivering the medicines. The thing which we had changed before COVID, during COVID and post-COVID is that earlier it used to be a physical model. During COVID it used to be a digital model. But now we're focusing on phygital model. We call it as physical and digital model. But the challenges would remain is that think of an example of a doctor who is doing surgery, meeting patients offline, and also he has to do arrangements to ensure that he or she is meeting online to the patients. So what has changed and what is required to be done is that in that ecosystem, all healthcare practitioners, including doctors, nurses, and support persons, tech enabling thing needs to be trained to them so that they were aware of the ecosystem in which they're carrying out their business activities so that each one of them could contribute to the system. Otherwise, it's going to be so difficult for the doctor because at least at the end of the day, it is they who are taking all the risks and providing their services.
Thank you so much. Thank you so much. Ashish, would you like to give your thoughts on this?
Yeah, definitely. The points that Biplav mentioned is that, I call it the super app phenomenon, right? What basically this just dial kind of did to all the services like sofa cleaning, this, that, and then we have the urban companies of the world which are giving all the home health services under one app. So similarly, the healthcare is also moving to this super app concept wherein they don't want the person to go to different apps for their different needs. Diagnostics, delivery, this, that, they want to integrate it. And the point which Biplav was mentioning is that people should be trained to kind of use that. So how digital can help is basically even though the super apps are there, the datas are working in silos. So if today doctor, let's say patient Vivek, he wants to order a medicine from any e-pharmacy, his data is there with that e-pharmacy guy, but is it being seamlessly passed on to the diagnostic chains? The answer would be there is a 50% drainage, right? So similarly, it can be true for the phlebotomist service or any other service that these guys may be offering. Though they have become a super app, but the data and everything are still there in silos. And digital can help in breaking those silos and make the data flow very seamless. So this is one thing that how it can become more, I would say, consumer patient-centric. If we have to take a more related experience is just let's say take an example of a fintech firm. They have today you don't have to go to a bank to do anything, right? You can make payment digitally, you can add a payee digitally, checkbook digital, credit card digital, debit card digital, everything digital, and we have embraced that, right? But when it comes to these super apps, there is a certain amount of, I would say, people are not embracing it the way it should have been embraced. Like we, even in the airports today, you see these DG Yatras and all that. So the adoption of digital is not that great currently in the healthcare space. Maybe because I think the reason can be because we have been so attuned to the physical delivery of care throughout our life that we are kind of hesitant. So I also used to work for a telehealth app called Librate like 4-5 years back. It was the second biggest e-consultation platform of India behind Practo, and it never kind of like, became, even if you see Practo also, it's not at a level 12 years old startup should be, right? Not even touching $1 billion valuation. So the key thing has been that people are so used to that feel of stethoscope, a doctor checking physically, that they are not trying to kind of like, break that barrier and everything. So, but having said that, I mean, yes, there has been a shift, but it could have been faster, I believe. Like in other industries, it's been a lot faster than what has happened in healthcare till now. Even with COVID, it has not, I would say, other industries have kind of like, had a quantum leap, but I still feel that even though healthcare did have that quantum leap of maybe 2-3 steps, but we again took one step back, right? So that is the current landscape, according to me, looks like.
I think very nicely put up. I think, look, for quantum leap, you require a paradigm shift. And somehow, whether we like it or not, human being by general nature is comfortable in his comfort zone. He becomes complacent in the comfort zone. He doesn't want to change very fast. Look, change is possible when change agent is powerful. And I'm sure these youngsters, the way in which they are moving this technology will make the things change much faster. Thank you so much, you have given a very good point. I know that we are running short of time. Let me quickly come to Biplab. What could be the future of digital health from both the angles, regulatory, from the commercial angle as well as from the legal angle? Then I'll come to Rijesh.
If I can answer the query as to why we are not moving ahead, maybe because of the reason that in India, usually self-medication is prohibited. There are legislation which prohibits self-medication. Though in the advent of technology, every patient is now a doctor. Today you go to the sites and you type out your symptoms that would give you a result using artificial intelligence, machine learning, or even Google that you might be having these kind of symptoms. And by the advent of e-pharmacy, what had happened is that usually otherwise I would not have known what kind of medicines are available for a particular disease or a disorder. Now I have a buffet of medicines wherein I could go and pick. Though this is something which is regulated by way of regulation, that this is not how something to be done. If there is a disease, you need to go and consult a doctor for that purpose. But now, if you look at the digital health aspect, now every doctor, I mean, I'm sitting in Mumbai, I can connect with the best doctor in Delhi. That would not otherwise would have been possible without any digital health. So this is something wherein, where I see the benefit out of it, but I see majority of the digital health company focusing on the, not focusing on the rural or tier 2 or tier 3 cities where more than 75% of a population exists. There might be cost constraints because in tier 1 cities, be it food, be it any other service, we can order it online. So ordering of medicine has become synonymous with anything, but I believe technology, be it artificial intelligence, machine learning, or robotic surgery, or robots, they're not going to substitute a doctor. They're going to supplement a doctor because we as an Indians or any individual who falls ill, it is less likely that they're going to go and speak with a robot or a technology. But I believe going forward, the technology is going to supplement the doctors or enable, I mean, enhancing their knowledge or capabilities to ensure that access to healthcare is reached to the millions.
Very nice. Let me share with you, somewhere in 1995, I remember to have met Dr. Devi Shetty, Narayana Rudhalayala. That time he was in the just basic of starting, somewhere 20 kilometers away from Bangalore. Bangalore was very peaceful then. And I remember, he was so nice to, talk to somebody. I remember he was talking to a patient who came from Guwahati to Calcutta. This was on video conferencing, way down. I'm telling you, I was physically present. And he was saying that you be here, I'm talking to the patient. And this fellow was talking in fluent Bengali. Dr. Devi Shetty is basically Kannadiga, talking in fluent Bengali to a patient who has come to a physician and Calcutta Park Street. And he was talking. I think since then it was, going on. But yes, now the acceleration which is taking place is much faster. And I agree with what Ashish and Rijesh they have said, that, pharma companies need to really tie up, need to have collaboration so that the reach become much faster. I'll add 1 or 2 points, before I go to Rijesh. Look, today we don't have, you talk about self-medication. Today we don't have definition of OTC drug. There is no legal definition. हम लोग OTC बोलते हैं, हम लोग OTEX बोलते हैं, but there is no legal definition as of now. There is no legal definition of life-saving drugs. There is a definition of essential drug, but the Drug and Cosmetic Act doesn't define OTC drugs. Drug and the Cosmetic Act 1940 and Rules 1945 do not define life-saving drugs. So I think we need to really do a lot of work in this area. Rajesh, sorry I have kept you.
It's fine, sir. So I think, I mean, to answer the future part, coming from an tech company and working in the tech domain, I would say that it's very bright. I mean, it's going to be shining more. There are certain areas I think as a health system or as a country itself we could bridge those gaps. One is like all of us mentioned, right? I mean, when you go and adopt a technology or a digital intervention in hospitals, there is an adoption issue. So where is it coming from? One is medical professionals or doctors. They studied all their life, maybe 10, 15 years, and they start their work. And no one wants to feel that this tech companies or IT guys coming and bombarding us with random technologies and making me learn things. So that should go right. And where it starts is, we should have digital health and technologies as a part of medical curriculum as well. So that would be something that we could start with in down the line 3-4 years. And another way to look at is also right now we all use applications, So how the AI is working also everyone knows. Even if you think of buying something, the next moment you will see it in your feed. So that is the way the AI is proliferated across the time. So the same is going to happen in healthcare. If you juxtaposition it, it is like if your body is going to have any sort of diseases coming, if you are able to predict it in early future, it's going to help. But definitely it all comes with a pinch of salt we have to take, and it's end of the day, it's patient data. It concerns country, it concerns human being. There should be a clear regulations, clear ethical protocols to it. But with clear regulations and ethical protocols, we could actually drive things. So adoption, I've been saying this word, adoption and implementation, because I have real world experience of it. So what I'm trying to again say is, there are small cracks which we need to fix to accelerate and amplify the adoption of digital health technologies. Then we will get results soon. And these results are not going to, not 10 or 15 years, I'm not talking. 2-3 years, we'll see a lot of results. And also, there are strategies companies also need to do, right? I mean, it's also not about what all I can do. It's also we have to take that wise call, what all to be done, what all not to be done. So exactly, Biplab was mentioning some areas. Let's not think that, everything we gonna, AI or machine learning is gonna come replace everything. See, healthcare, in its conventional nature, it is patient care. It's a relationship. It's very divine. It's very, it's from Vedas, right? It has its own history, culture, and everything. It cannot be replaced or anything. So, but we have a saying in our AI community. We say AI will not replace a doctor, but a doctor who uses AI could replace a doctor who's not using AI in a longer run. So that way things could change. Yeah, I think that's all. But I wanted to summarize again. It's all future is very bright. We all have to join the journey.
So thank you so much. I think last point from each one of you. What could be the take-home message? Ashish, can we start from you? Rajesh has already concluded.
So take-home message, just to build on the 2 pointers which both Rajesh and Biplab mentioned, that and you also mentioned that there needs to be a paradigm shift. One paradigm shift has already happened, which is the nature of the patient of the today. Like you were talking about self-medication and all that. Today's patients is much more informed, inquisitive about his treatment plans and everything. And who has made him more inquisitive, more informed about his treatment plans and disease? It's the digital world, right? It's the net, internet, everything. So digital has already done that paradigm shift, wherein today's patients are much more aware and involved in their treatment plans. And like Mr. Rajesh mentioned, a doctor who will not adopt to these kind of inquisitiveness and inquiries from the patients of today will be left behind going ahead, right? It is not a physician-driven patient treatment plan currently, which most of the customers are following, at least in metro tier 1. Rural, maybe that might be the case. And the future, if I talk about, like these people said, definitely it's bright. And like the conference that we are having, collaboration is the future. There are different stakeholders. All the stakeholders need to collaborate with each other. And digital can be that bridge which helps all these stakeholders collaborate, and embracing digital will definitely make healthcare more patient-centric is what my final submission would be.
Thank you so much. Biplab, quickly.
So I'll conclude quickly. So I call it as TRICS. It stands for technology, regulation, infrastructure, consumer, and stakeholders. So the way I look at it, there are challenges in all 5 forms. Technology, we are evolving. Regulation, I would request, if I can, the regulator needs to step up and be proactive. If they are regulating the subject matter, they need to be proactive in ensuring that they cannot now deny that, I mean, in 2024, the technology cannot be exist, or this particular technology, we cannot be working in healthcare unless and until it causes harm. But there is a saying that the food does not come from the fridge, it comes from the farmer. So in terms of infrastructure, we believe that though the tech enabling thing can happen and can take us forward, I believe investment in infrastructure needs to be done. And third, last but not the least, consumer and stakeholder consultation. So there have been few instances in the past that were in the regulation, and within 10 days they had to withdraw it. So because they have not consulted all the stakeholders properly, they felt that, okay, I mean, they're coming out with regulations in a hurry-burry manner. That should not be done. They should be consulting all the stakeholders, including online or offline, to ensure that the patients which are being targeted, or you know, who are the end consumer or end thing of this, they are benefited. So that will be my statement.
So thank you so much. I think key message is shape up or ship out. One. For regulator, I guess that more than regulation and controller, the regulator should be enabler of technology and enabler in the contribution of the stakeholder. I think very nice. Thank you so much, Biplab, Rajesh, and Ashish, to take time out and contribute. We have, I think, a small talk on this role of nutrition in the journey of patient. Anoksha, there's somebody there? Somebody will be talking on this? Can anybody talk on that? Role of nutrition in the journey of the patient.
Like nutrition is something like, you know, it's also like it's very much digital right now, right? I think that is one domain which has been digitized very nicely maybe post-COVID, last 5-10 years. This calorie tracking starts with that. I mean, people are very much aware of what they are eating, and it's a very good practice. I mean, that is something that maybe we Indians got to that habit a little later, but you know, it's very lovely to see that, you know, there's a lot of attention which the whole arena of well-being and nutrition is getting, and people are following it, and I think there's a lot of scope for digital interventions to come into that space. So tracking, because, and the best part is comparing to the actual you know, healthcare. So here the regulatory frameworks are also a little more, you know, comfortable. So it's easy for more companies, more thought processes, more innovators to come into the place and see how this space can be taken up. So, and it is like, it's definitely it is, when we say health system, well-being and nutrition is part of it. It would be part of it going ahead. And I think there is a lot of, you know, waves coming around it, and Healthify Me has been doing really good in that space. And there are other apps who do the same thing, right? Tracking the food. And something which was missing in that was, it was always a Western concept, right? People didn't had that, never know calorie of an Indian dish, but that also has been now tackled with the data, with the help of existing database and the engineers. So there's future is bright. Nutrition is something that there's a focus is needed.
I would like to contribute. I think somebody has raised this. My contribution for role of nutrition in digital health in general, I could give an example. Like in a cardiac or the diabetic doctor, diabetologist or the cardiologist or the physician, after his prescription, you always try to ask the patient to go to dietitian and advise properly. Also, let me tell you that there are many areas in diabetes which are well controlled with nutrition rather than medication, including metformin, beginning a dose, you know, of diabetes for the diabetic patient. I think role of nutrition is quite significant and it is underplayed. And I think over a period of time, digital evolution, digital innovation can contribute substantially. Thank you so much. From our side, we are through. You can take it over.
Thank you so much for the insights. Now I'd like to call on stage Dr. Anushka Amlani to felicitate our panelists. Mr. Lilin, Mr. Rajesh Bose, Mr. Ashish, Professor Vivek, I request all the dignitaries to come forward for a group photograph. Thank you, everyone. We are setting the stage. Welcome to our next session, the power of patient advocacy and community engagement. In this discussion, we will explore the critical role that patient advocacy organizations and the online patient communities play in advancing health literacy, influencing healthcare policies, and driving inclusive healthcare. Our panelists will highlight successful advocacy campaigns and community-driven health initiatives that made a real impact on patient care and outcomes. Let's dive into those efforts are empowering patients and creating lasting change in the healthcare landscape. Dignitaries joining us for the sessions are Ms. Vasundhara Raghavan, CEO, Kidney Warriors Foundation, Mrs. Alpna Sharma, co-founder and trustee, Kyo SMA Foundation of India. I would like to request Mr. Prabhat Sinha, Director Public and Government Affairs, Bohinger, Ingerheim, India, to guide this very important discussion and enlighten us all. Please put your hands together. Over to our panelist.
So, good afternoon. I don't see any reflection of good afternoon. Yes. There is no seat belt, otherwise I would have asked you to fasten your seat belt, because what you are going to listen in next 30-35 minutes will make you sometime uncomfortable, sometime very motivated. That I am sure of, having two panelists sitting with me. Now, so this is a very unique summit that IHW organizes, Patient First Summit, right? And it has two objectives, if you'll notice. One is to celebrate and acknowledge the patient-centric initiatives. That is the second part of it. But first is to listen from patients. And there cannot be a better session like this, where you will listen what they want, what they have been going through, and what they have done. The second thing I always say that, there has been a long that somebody has been talking on somebody's behalf. Right? It's very easy to talk on somebody's behalf. But if we have not experienced that, it cannot be a legitimate experience. Do you agree or you don't agree? Right? And that's why this panel is very unique. First, two women leaders. You will not see such panel where you have 100% panelists who are women leaders. So clap for them and also clap for IHW Council. Second is that they are not going to talk on somebody's behalf. They are going to talk about a condition for which they have been invested, they have been fighting as an individual, as a caregiver, and that's why there is a lot of legitimacy that comes from it. The second is, since it's after lunch session, I would just want in the audience, those who feel you are not a patient, can you stand up? Those who feel that you are not a patient. Those who feel you are not a patient. Okay? One, nobody? Okay. Everybody is a patient, right? Including me. Any of you who feel that you are not a caregiver, can you stand up? Right? That means that, it's for all of us. It is not that patients are sitting this side and providers are sitting that side. So we all are together. It's just, for this 30 minutes, two of us is representing patient community, but we all are in the same boat. So what we are going to discuss is also going to impact each one of us. So always remember, it's not patients versus government. It is not patients versus industry. It's not patients versus somebody. It's for everyone. Because even person who are providing healthcare are also people living with or caregiving for somebody, right? That's all I have to say, and rest you will not hear more from me going forward, because I will invite, and I'm not going to introduce either of them because they need their own introduction. So over to you, first Vasundhara ji, and then Alpana ji.
Good afternoon to all of you. I'm Vasundhara Raghavan, and I'm a kidney donor to my son in 1999. This happened after he was late detected with chronic kidney disease when he was 15, and we had missed an opportunity when he was 10 years to get the second opinion to bring us close to the disease. So having lost that chance of a second opinion, he landed with kidney failure in 1996, and this was due to the vesiculateral reflux, so that there was a backflow of the urine, and over the years, from the time of birth, he has been developing the disease slowly. I donated my kidney after being treated for breast cancer. I had a surgery, chemotherapy, and radiation. And I had to actually force my doctor, the nephrologist, Dr. Bhupendra Gandhi, to help me to donate this kidney, because a cancer survivor could not have donated. That was something in those days. I think it's now not so strict. People do donate. Now, in 2014, since I was going through this tremendous guilt of not having detected my son's disease early, not having given him a chance to live healthy like others, I wrote my first book in 2010, The Shades of Life. Thereafter, in 2014, I opened a Facebook group, The Kidney Warriors. And I was living in Dubai those days, and I worked on the Facebook to reach out to patients in India, because I had enough knowledge about the disease, and I could help many people, guide many people in India with the type of knowledge I had on nutrition and on the disease. So I opened two groups. One was the Kidney Warriors and one was the diet group. And thereafter published more books, The Kidney Warriors, Book 1, and a book on nutritional secrets for kidney patients during dialysis, post-transplant, and for peritoneal dialysis also. And then we had another book published, Healthy Recipes for Kidney Patients. So after, these were only the books that I published, the group grew from 0 to over 7,000 on Facebook. We have WhatsApp groups by cities, by states. We have individual leaders in Rajasthan, in Telangana, they are also running a similar trust, a smaller one, under the Kidney Warriors umbrella. And they are all post-transplant patients from all over the country who participate in transplant games. We encourage them to be physically active, we mentor them, we allow them opportunities to do webinars with the doctors, so they are the moderators, patients are the moderators for the webinars that are conducted by Kidney Warriors Foundation. So this webinar, of course, became popular during the COVID. We have got a full YouTube channel which has webinars on information on dialysis, how to manage your blood pressure during dialysis. Questions like, why does my blood pressure drop during dialysis? So these type of questions get answered by these doctors. And our doctor support has been there throughout. We have over 300, 400 nephrologists actually helping us at different times of the year or through the journey of Kidney Warriors Foundation. We formed our organization in 2017, and when I sent the first book, The Kidney Warriors, to the Prime Minister, I was added into the National Committee for Dialysis, the NATCOM, for National Dialysis Program. So thereafter, I could write to the government to seek any changes and modifications in the dialysis. So the single-use dialyzer was introduced, and when Karnataka dialysis program was not going on well, we could take it up to the government, at the center and state, to see that the service provider was changed. And we sort of brought in some sort of stability in the dialysis, so the people in the rural were getting good quality dialysis. So this is a small introduction about Kidney Warriors Foundation and my own work in Kidney Warriors Foundation.
Thank you, Vasundharaji. Thank you. And if you remember what Vasundharaji said, that I know about this disease, right? And I need to tell this to others, that how this disease impacts us, and the journey from maybe 1 to 7,000. I don't know any other patient group in India having this much of network, right? 7,000 across the country with so many leaders like Vasundharaji she has developed, right? So kudos to you, what you do, Vasundharaji, every day.
So good afternoon, everyone. I'm Alpna Sharma, co-founder and trustee for Cure SMA Foundation of India. My 10-year-old son, Arav, has this rare genetic condition called spinal muscular atrophy. And it was his diagnosis which led me to this journey. Because in our family, we didn't had, like many of us here, even I didn't had any kind of notion about rare disorder or rare diseases, because these are one of the most neglected disease or therapies that are there. When Arav got diagnosed, I was working, my husband was working, he was the first child, and it was a very happy movement for us. So the first year went, but we could see certain things amiss. And I could see that, he was kind of not able to meet the milestones, but, and I come from family of doctors. My sister is a gynecologist, my brother-in-law is a pediatrician, neonatologist. So my brother-in-law, in fact, said that there's something amiss. But somewhere, my sister said that because you get to see patients every time, so she joked that maybe you are seeing as a patient. However, by first birthday, when RF still could not even stand with support and sitting was also going, the diagnosis, I would say the journey for diagnosis also started. Because diagnosis of rare disease is also not easy. And after he was diagnosed with this life-threatening condition, because spinal muscular atrophy is a life-threatening disorder, it happens due to mutation of SMN gene. My world shattered. I was like, why me? Why my child? Why it has to be? Why it is us? And from there, today, we have grown to a place where we are connected with 1,800 patients, and thankfully, there was, my brother stays in US, California, and there is a foundation, international organization called Cure SMA, we attended the conference, and that was kind of eye-opener because we saw these SMA children, they are cognitively very bright. So despite the condition, they were living a very good quality of life. And that kind of motivated me. I came back to India as a change person, started looking for similar-minded people. And very much like Vasundhara ji, actually, I started a Facebook page in 2010. So that Facebook page, I got connected to my soul sisters, I would say. We are 5 mothers from 5 different locations today who are running or trying to do whatever the support group and advocating with all the stakeholders. So Cure SMA Foundation is an organization which is led by parents, mostly by mothers, also by fathers, because we couldn't do without the support of the partners, so it's the parents. We are a parent-led organization where we are trying to get all the stakeholders together on a platform, that is external stakeholder, the pharmaceuticals, the government, industry, the HCPs, and our internal stakeholders, which are patients, parents, and caregivers. And through this platform, we are trying to work on strengthening the ecosystem for our country, especially for rare disease. And there has been, I would say 3 key wins along with, the monumental challenges that we have been facing. So we have been instrumental in amendment of Drug and Cosmetic Act of our country. It is very interesting that, the Drug and Cosmetic Act of our country is actually of a British era. There are many clauses which have still not been amended. And the condition like spinal muscular atrophy requires innovative therapies. And we are very grateful to, pharma is often seen with the eyes or industry that they are making profit. No, they are also saving lives. The innovation is as important as anything. And innovation comes with a cost. So of course, there is a lot of discussion or debate on this, but because there was a treatment and the pharma company was willing to bring that therapy to India through compassionate use program, but there were certain regulatory issues. We made a representation to the Drug Controller General of India, and the government does listen to this. And here I would like to thank Prabhat sir. He has been kind of mentor to us. See, because we are not professionals, we were never trained to do today what we are doing. The advocacy requires a lot of training, the kind of systematic work, building strategies. So sir has been constantly guiding us how to write to the government, how to reach out to the stakeholders. So we made a representation and we were included, our representation was included, and there was amendment in the act. The compassionate use program provided drug to the children, and then there was, expedited access for the one and only treatment that is available for spinal muscular atrophy in India. We again sensitized, we got the SEC committee, which has, only the doctors who were not using the drug. So we got the doctors who were actually using the drug through compassionate use program to get their opinions or their data included, and it led to the expedited access. And recently, there has been, again, I would say advocacy is also a journey, and there's a monumental challenge in treatment access. So we filed a petition, and with the help of judiciary intervention, judiciary has directed the government, the Delhi High Court has directed the government to allocate some resources for not just SMA, but for the rare diseases altogether. So that was about our work. Thank you.
Thank you, Alpna ji. I think what you heard may not be even 20% of what they have contributed in this country when it comes to rare disease. There was a headline that hit, I think, a month back, which says that government has allocated 900 crore rupees for rare disease in this country. And if you'll see how it happened, it was from a petition from patient and patient groups. I think every hearing happened in presence of patient leaders. And government has to answer, and still they don't have an answer, right? Because it's tough, it's not easy for anybody, but because the topic of this panel was power, this is the power. That few individuals, handful of mothers, right? They raised their voice, they reached everybody, and when nothing worked, they went to court, saying that we have right to live. And then court acknowledges that yes, what you are asking is very legitimate. And then they brought probably every stakeholder in on the court floor. And then government is finding solution. So it's not, sometime we feel that, okay, the solution will come, but solution may come after 5 years, may come after 15 years. But there is a price that we pay for that gap. If it doesn't come early, people who are being impacted, they don't get benefit in their own lifetime. And that's why every day matters, because somebody is losing life every day, here or there. So that urgency can only and only be felt by whom? People who have been impacted by that. And that's why I say that, it cannot be more legitimate. That power comes when you really go through that condition. And that's how, if this whole space is being re-looked the way it should be, a lot of credit that goes to Cure SMA as an organization. Again, largely a mothers-led organization. The way they, even now, I know, and I'm thankful to both of them, a mother, how she comes to this, she had to take RO to give an exam. Leaving him at school, she started at 12:30 to come here, and then RO is at his own with some help at home. And he will wait for Alpna ji to come back to home. So it's not easy for them to come out even for an hour discussion. For us, it's a profession, right? We go, we attend seminar, we speak. But for them, taking 2 hours is a lot of preparation. You cannot leave somebody like this. And that's why sometimes you feel that these seats are occupied by somebody who do not deserve that seat. They don't deserve that seat. But they occupy that seat because people like Alpna ji or Vasundhara ji is at their home caregiving somebody who needs it, right? And we have to learn to vacate this seat for somebody who really deserves this seat, right? And thank you, Alpna ji, because coming from Navi Mumbai to this place, 3 hours travel, and I'm saying that we may not experience it, but 3 hours of travel, 2 hours in this workshop, 5 hours, RO is at home, right? Brilliant boy, I'm saying this, he will be very happy. I know, he will be very happy because Alpna ji is not at home, it is his time, right? But at the same time, a mother will always think that what he is doing at home. So that's why I think these two examples, if you'll ask me, my session is over actually. There is no more things that need to be conveyed because this is the power. But since I have 14 more minutes, we will use it, right? To get this power, somebody has to empower. And that is where I think people sitting the other side has to come forward and be part of their journey and empower them so that they become more powerful. If they are powerful, patients, industry, everybody, it's a system where we all coexist. Somebody said in the morning session that if there are no patients, we will not be having a previous session, which was on digital innovation. There would not be a session before that also, and before that also. So ultimately, we all do for patients. Have you ever heard about an organization which is non-patient centric? Every organization is patient centric. But sometimes we leave patients at center and we all dance around that. Patients is at center only. Patients has to be connected. And that's where these forums and these organizations play that role. Now moving, before I move forward, I think I pass the mic to the other side. Please feel free to ask some of the question which is going on in your mind at this point of time. So if there is somebody who can pass microphone and ask questions to, if you want to compliment, if you want to ask question, if you want to ask anything, please. I see Ketan. Yes.
My question is actually to Vasundhara ji regarding kidney.
Ketan ji, if you can introduce yourself, please.
Yeah, sorry. I'm Ketan Kothari. I represent Xavier's Resource Center for the Visually Challenged, part of St. Xavier's College in Mumbai, and will be speaking in the next panel. But my question is to Vasundhara ji, and because kidney disease is something that one really dreads. I just lost my aunt due to this couple of months ago. I was wanting to know, does transplant really help, and what kind of quality does a person live his or her life in an ordinary middle class condition? I am not talking of people like Sushma Swaraj who will get all the possible facilities in the world. I'm talking of person like Ketan Kothari or somebody like us. What quality of life will he lead? And if you also name your YouTube channel, because and I don't know whether your books are available in Kindle format so that people like us can read them and understand more about it. Thank you.
So the quality of life is very good. We have one person here, Ritu Parna Banerjee. She's had 2 transplants. Ritu, just come up here. She is actually the CSR director for Kidney Warriors Foundation. She has had 2 kidney transplants. And she's working, she's running her own organization. So you see there's no problem, people can live healthy. And regarding the books, we have it all on Amazon, but I don't know if all of them are on Kindle. But the book, any book you require, you can message me. We can give it to you at a discount so that you can see the book, the hard copy as well.
Okay, I'll just add to what Vasundhara already said. So answering your question and to maybe many other people who are out here, right now CKD is progressing at almost pandemic rate. So very soon, by 2040 almost, if we don't act now, all of us will start having at least one patient at home, right? So it is very important that we know about this disease. Answering his question, to be specific, I'm a twice transplanted renal recipient. This is my 25th year. We can definitely lead a fruitful life. After the 2 transplants, I have been running my own organization. I have around 300 people working for my organization. And at the same time, I am working for KWF also, because I realized that nothing has changed in this 25 years. During COVID, my diagnosis was delayed by 13 years. And during COVID, I came to know of another case wherein a young girl, 19 years old, she also got to know about her kidney disease at the 5th stage. So 25 or 20 years gone by, and nothing has changed in the healthcare system, right? So my request to all the technologically advanced people here, we heard a lot about AI. If we can, get your help in the medical fraternity, helping the doctors to find out something wherein diagnosis can be done in a faster way. It will really help the entire CKD community, not only in reducing, the healthcare cost, but of course in helping the patients to live a more fruitful life. And to add to this, I would also say that I am a mother, I am a wife, I have a 10-year-old, so we can definitely lead a very good life. Yeah.
Thank you. Thank you so much. Very powerful. But I think the Ketan one asked that he will not leave you without you, is an accessible book, because when we talk about healthcare, I think there are many layers, and he will talk in his next session, so I will not take that thrill, Ketanji, out of this, but only thing that he will not allow you to leave this place unless he, and this is the power. There's another group when we think about patients. Within patients, there are people who are living with certain disabilities, and very nicely, that session will follow, so I'm not going to talk about it, but there are so many convergences, and I'm happy that one thing that will start from today, from here. So, moving to the next thing now.
Sir?
Yeah, some
this
question.
side.
Dipanshu Roy here from Compass Group. To begin with, like very emotional and very touching stories I heard, and probably it will be resonating with everyone. I have like kind of two questions to ask, like if anyone can answer. That first, that how to amplify these kind of stories via digital mediums, or how to spread these messages, because it's very important to first diagnose also in the early stage what our story is actually. And the second would be what just ma'am just said, that how technology can actually play an important role to detect or to even kind of again spreading the messages, because these things normally like people are not aware that when to detect, what kind of actions to start,
Thank you.
then the government intervention.
Very good question. I think the answer lies there also, right? The other side, that how to do this, but at the same time, what you want this to happen. How do you feel? It's a very good question, but how you want this to happen?
So let me first do, then you can take it over. We have many patients who will be very happy to share their stories, because the more we promote them, their stories, there is a chance that many people will know what kidney disease is, because people are in fear of kidney disease. Like he said that he was very scared of kidney disease. Everyone is scared of kidney disease. You don't want to get it. No one wants to get it. But once you get it, you know that you can survive. That is a very big motivating factor. So we will be happy to share any number of stories. We have already got them in a book, and we can get you any number of stories that you require. Thank you.
So thank you for your question. See, that is where, we talk a lot about patient centricity and amplifying the patient voice, but when it comes to actually practicing it, there are very few people who are doing it. And again, I would like to thank sir for this, and many of you who has been compassionate, because we have so many of our own challenges, the actual patients or the caregiver, that for us to get out of those challenges and reach to or network with the stakeholders is also very difficult. But at the same time, what I have experienced in my journey is the power of collaboration. Once we collaborate with right people at the right platform, it can help us a lot in amplifying our voices. For example, there's media, the media, print media, or many with the internet, in this era of internet, there can be hundreds of ways, innovative ways to tell these stories, and these stories have the power, especially, as we all are somewhere the patients or the caregiver. But when it comes to rare diseases, the very nature itself is such that it affects a minuscule population. So I always say that until and unless we become the self-advocate, the patients, they themselves need to advocate. They cannot, the power, whatever is that lies within, that needs to be motivated and they take into the right platform. So the collaboration is important, the opportunity is important. That was from my end. Thank you.
So from Government of India's initiative, like are they advocating or are they kind of trying to disseminating these kind of rare disease messages to create awareness among all the stakeholders or the citizens?
I would say there is national policy for rare disease, and there has been some amendments, and we have been constantly writing. And I was today in the afternoon only discussing, see, that initial journey, we are not professionals. And I remember having a conversation again with Sir, and he told us that we are today, 1,800 members, but 5 mothers who from different locations who are running. And Sir told us, why don't you write a letter from your foundation letterhead to each MP and MLAs? And we did that. We sent 800 letters to the MPs and MLAs, and we got the response. And there were questions in the question hour in the parliament session that was raised. The GST, for the GST waiver, because these treatment, it comes to, there's a lot of support, multidisciplinary support that is required. It's a, comprehensive care that is required. So coming to, the Government of India, it's not going to happen in a day, but yes, we are advocating for this, and we have been writing letters to all the stakeholders, the MLA, MPs, and we have also tried, because one of the way to attract the attention is through judicial intervention. It's not easy, but we have done that as well, and it's under process.
Thank you. We have 2 minutes left now, so 1 minute to each one of you. If you have to ask You have two wishes, right? And if this is the audience who is going to fulfill your wishes, what would be those two wishes, Vasundhara to you?
I thought about this since last night. I've been thinking, what will I speak? So I realized that this is one thing that I want to say, that there is a lot of confusion in everyone's mind. They think that dialysis is not so good, so it's a transplant, which is a better quality life. But how many people can get a transplant? We don't have that many donors. So how will they get the transplant? And how will they, not all of them also qualify for a kidney transplant because of health reasons. The disease may recur, so they may not be advised by the doctor. So the confusion is there. So to cross this hurdle, Kidney Warriors Foundation changed its focus in the past 4 years to prevention of chronic kidney disease. We joined hands with Dr. Arun Gupta for the, ultra-processed food, the labeling on that. And then we also had a lot of conferences with all the doctors, nephrologists, IMA doctors, family physicians, all kinds of doctors, gynecologists, to understand which is the time this kidney disease can be tracked. I mean, where can we try to stall this? So our focus now is to see that people on hypertension and diabetes are maintained there. So we are trying to do all sorts of somersault to get to the right people and say, hey, listen, please try to manage your diabetes or hypertension and do not let it fly. Because, kidney disease is no fun. So that's the type of message we are planning to give. So this book we have published has patient advocacy. It has gone to the government, so it has patient advocacy. It has a chapter on prevention. It has what programs are done for prevention by Tamil Nadu government. What is it that the All India, what should be done at the All India level by the other states is prescribed here. The foreword is by the Director General of Health Services. And there are a lot of lived stories in this, lived experiences, plus resources on managing the disease by doctors. So, all the questions that the patients have about BK virus, CMV, and all those things that they don't know, vaccinations, when should we take a vaccination, all that is covered in this book. So it is a complete resource for the people with chronic kidney disease in India.
Thank you. So, Alpna ji, if you can focus, two wish.
Yeah. It's, I would really request everyone to be considerate in making the society more inclusive and accessible. Because I feel, this is the forum where we all are citizens, we all are, somewhere educated. If we can sensitize our people and society in general to be more inclusive. I have, with my son Arav, I have seen even in city like Mumbai, the kind of, malpractices that are there. As I said, SMA children are very bright. So today itself, my son had this NSCSE exam. He has been preparing for these exams from past 3 to 6 months. And these children, they bring laurels for the school. They do reasonably well, but the attendant didn't turn up. I had to put in a special request with the school, which school kind of, considered and then allowed. Where I have seen people talking something but doing, practice what you preach. They also have, equal right to live. So making it, and, Arav asked me yesterday night that, Mummy, why am I like this? Why God has made me like this, where I'm dependent on other people, the attendance to, even for my basic needs or even for going to exams and for my academics. And school has a policy where they don't allow the parent to be there. So, and there are many incidents where I have seen people, not practicing the inclusivity or even the accessibility. So in general, I would say, because on the government front and other things we are fighting, but yes, as a human being, as society, we can definitely do this.
I think it's with this message of all of us being more inclusive, listen more, speak less, I think we should end this session. And I would request you to give a standing ovation to both the panelists for their work.
Thank you.
Thank you so much for giving a deep information, and that story was really amazing. Now I'd like to request Kamal Narayan sir to come on stage and felicitate panelists. Ms. Vasundhara Raghavan, please put your hands together. Ms. Alpna Sharma. Mr. Prabhat Singh. Mr. Prabhat Sinha. I request dignitaries to come forward for a group picture. Thank you, everyone. Just a few minutes, we are setting up the stage. Our next session is Bridging the Healthcare Equity Gap, New Strategies and Solutions. In this discussion, we will tackle the pressing challenges of healthcare equity in India and explore innovative strategies to close the care gaps. Our panel will dwell into the role of policy reforms, insurance innovation, and grassroots initiatives in ensuring equitable access to quality healthcare for all. Join us as we examine how these solutions are working to create a more inclusive and accessible healthcare system. Dignitaries joining us for these sessions are Mr. Vipin Pathak, co-founder and CEO, Care24. Mr. Ketan Kothari, Managing Consultant, Programs, Xavier Resource Center for the Visually Challenged. Guiding this insightful discussion is our esteemed moderator, Professor Nadira Chaturvedi, co-chair, Patients for Patient Safety Foundation. Over to you.
Good evening. Am I audible? Good evening, and thank you, first of all, for allowing us to be here, inviting us to be here, and waiting till the end to hear us out. This is the last session, so I think you might hear echoes of all the earlier sessions, the insights that we've been gathering since the morning, brilliant pieces of work done, pieces of research, and suggestions and policies that came across. Excellent. And I'm happy to be here just as part of this panel. I think there's a lot of synergy in the previous forum, and you might even think it's a continuation of the earlier people, although we won't match their eloquence. But even then, there are brilliant people in this panel, and we have two very different people here. Mr. Vipin looks after Care24, and he'll give us insights on home care. And I think Ketanji will give us even more on the exclusive area of disabilities. I think they are the best people to introduce themselves. Ketanji, over to you. Can we begin with you?
Good evening, friends. And very important things I must mention at the outset. I basically am, my name is Ketan Kothari, as was announced. I work with the Xavier's Resource Center for Visually Challenged and am active in the disability sector for more than 30 years. I think my gray hair does tell that. And I am extremely grateful to Prabhat Sinha ji for giving me this opportunity to participate, because you know, disability people meet in conferences and we talk to the converted people. Talk to ourselves about our problems. Most ridiculous thing actually. But today, probably first time in my 31 years career, I am talking to a group which is almost totally unaware of what disabled people go through, and more so as patients and caregivers both. So why do I say that? I say that because I have been obviously a patient. I am a caregiver of my mother, who is very old now. And I have stories of people who have been disabled and have been caregivers of their parents and have to lose parent because the doctors did not take that person seriously, although she is a disability rights advocate herself, and trained in architecture, no less. So it is a very sad story. Now, what are the things that, because new strategies and solutions, right? There's no point only in complaining, ye nahi ho raha, wo nahi ho raha, fine. तो नहीं हो रहा, आप क्या करोगे? So now there are 2-3 important areas that need to be looked at. First, as patient, since it was said in the last session that, well, patient is at the center, but everybody is dancing around him, ignoring the patient. So why are we not thinking of preparing the system right at the outset for people who will have disability? Also remember that as we grow old and our lifespan increases, chances of any of us getting disabled are higher. So disability is no longer between us and they. It's only us. Who knows what tomorrow holds for us? Us as in everybody. And the other thing is that what if the disabled person is the only caregiver of his family? Are you not going to take him seriously? Are you going to treat him like a perpetual minor? So the system has to be prepared. Now today I would say, we were talking of Dolo and digital innovations and all that, and I was fascinated, but at the same time quite disappointed, because nobody ever thought of people who would be disabled and would need digital intervention. How do I even know what medicine I am holding in my hand and when does it expire? I am going purely on the faith that I have in my chemist. Although I am a MA, MBA, I have no way of knowing it. Why cannot we have systems laid down where disabled people can lead their lives independent? Now my wife and I are both blind. We have no caregiver at home. So am I going to trouble my neighbor every 2 hours? Sir, ye goli dekh ke do, madam, ye goli dekh ke. The third time I ask that person, the person will say, ek kaam karo, ab goli lena band kar do. You know, so the innovation has to take care of all the social minorities, as I would call ourselves, because anybody could walk into this minority, willingly or unwillingly. I mean, unwillingly, of course, not willingly, but yeah. And hence, this digital innovation has to... The other thing is, patient welcoming at various medical centers and hospitals. Even the best hospitals in Mumbai, I have been myself, there are no systemic arrangements, staff is totally insensitive. I've had cases where a couple of people who are blind have died of COVID because there was no proper help. And in those days, we all know that touch was prevented. I don't know whether you people know, we are talking of patient summit, patient rights summit, that certain countries had exempted people with disability from this touch insensitive, I mean, they were allowed to touch because there was no other way out. But in this country, people have died because nobody was there to help them. Imagine a condition if that person were your brother, sister, or mother or father. Today, when I go to hospitals and I want to meet a Dr. X on 7th floor, I have absolutely no assistance. System is not ready for me. And people do try to help on their individual volition, but there is absolutely no systemic arrangement. Why can't we, people who are decision makers, and I'm not talking of politicians, politicians are not the only decision makers, people who are running private organizations, we as Xavier's Resource Center for the Visually Challenged are willing to work with you to sensitize your staff. We already have a two and a half hour long program called Antar Chakshu, where we sensitize people about the lives of persons with disability and what to be done and what not to be done while helping them and working with them. So that can be done. The other thing is that both in the area of patient care and parent or caregiver confidence, innovations need to be brought out. People with disability, and there are 21 impairments that are regarded as disabilities in our country according to our law, they have to be given rights that any other patient has, and more so because remember one thing, that they are not going to be able to use the facilities that are meant for non-disabled people in most cases because they are not accessible. Just, I think Alpana ma'am mentioned about accessibility. I have not seen any hospital, any hospital where there are proper ramps, where there are, post-operative care when the patient is shifted. The washrooms are not disabled friendly. They are not, a person with disability who's using wheelchair cannot use those washrooms. And I've had examples of people getting UTIs because there was no proper facility. One of my friends was just telling me today that her gallbladder burst. She did not drink adequate amount of water for days and months because no accessible toilet. So,
Ketanji, would you like to say anything on the policy level that can change
no,
all
so
these things?
I'm coming there, yes.
Thank you.
So, when these kinds of conditions are there, the health policy that the country has must mention disability and issues related to them as part of the policy, and non-compliance should lead to huge fines and penalties. I'm sorry, I'm being very severe, but because our constitution talks of right to life and life with dignity, that dignity has to be given to all, including people with disabilities, so that they can lead their lives and are not dependent on other people for their basic necessities of care responsibility. Because if I can't be responsible for my parent, and if I'm dependent, or if I'm not getting the care that I deserve as a patient, both ways I am frustrated, which leads to my getting into depression and leading to other health conditions which are not welcome. So I would like at least this dialogue to start, and I am again repeating that if anybody wants to work with us, we are here in Mumbai. St. Xavier's College is very well known in Mumbai. Please communicate with us, and I'll be more than happy. Let the conversation begin, and then we can also talk to the policymakers to get the policy implemented, policy inclusion. But even without policy, nothing prevents us from implementing these things, because it's the chicken and egg question. Policy pehle aayegi ya hum implement pehle karenge? Either way, because in this country, law has come first and the policy has come later. Disability law came first, the disability policy came later. So, thank you, Professor Nadira, but I'd like people to have interventions after Bipinji has spoken, because I'm sure disability is an area where people have had not much of an exposure. Thank you.
Thank you so much for all that suggestion, and I'm sure the dialogue will kick in. A clap for him. And we need voices like you to take this forward. Vipinji, over to you.
So I think I'm the most underqualified person here to talk about this, but still. So I run a company called K24. Just to give you a 30-second background about myself, I post my IIT. I was with consulting companies like PwC and Ernst & Young for almost about 7-8 years before I started K24. The idea was very simple. We are always troubled with our parental health. We think that we are not taking care of our parents, and especially parents, grandparents, and especially if they are sort of having some illness. And it became even more, I would say, serious when if you're not staying in the same place and things like that. So we thought that we have to find a structural solution to this, because earlier days, if you remember, there used to be some doctor or a compounder who will go to your place and check, do things, have a chai with your parents, and that was the way the primitive healthcare was sort of working maybe 30 years back. But that structure is broken, the family doctor and all that concept. So we thought that maybe we can be troubled, we can always talk about the problems or find a solution. So we thought that, okay, we'll do this elder care. Now this, we started in 2014. Today we serve about 1,200 patients every day between Mumbai, Delhi, Bangalore. What we effectively do is try to bring hospital sort of a care at home. So anyone who's troubled with, I would say, mostly we deal with serious illness, cancer, dementia, a lot of neurological disorders in general, which has made them immobile. So what we try to do is, like, rather than them always having to go to a hospital or struggle with that problem, we support them with basic care, like an attendant who would help them with mobility, to something like setting up a mini ICU at home, where we would do almost everything, and we can do maybe something like chemo at home. So it could be as serious as that. Yeah, that's roughly about K24. I think I'll talk more about this.
You had mentioned something that you managed to change in the insurance. Would you like to highlight that?
Yeah, I think our solution, if you look at it like, how do we, 2-3 things, right? One is the awareness part of it, and the accessibility part of it. Now the accessibility is a big trouble, right? Now in the accessibility thing around healthcare, there are two major issues, right? I mean, one is the cost part of it, and as Ketan was mentioning, policy first or law first. Our struggle was that the insurance was always saying that whether we should adopt home care or not, we don't have a data around it, right? So we said that, okay, let's prove it. So we proved it over almost like more than 2 lakh patients, saying that every time a patient is with us, the chances of him getting hospitalized gets reduced by 77%. And that's a huge number. I mean, if you look at this number, right? Not only that, right? And if the patient is with us, the cost gets reduced massively, maybe over 70%, right? So you are, once the cost is lower, then insurance also said that, look, this is a fantastic idea. I should increase the scope of my services. I should cover more. Today we are serving over 36 cities in India. I'm like they're sort of opening up, so I think it is going to take little time. So the numbers are not very huge at this point in time, but I would say every month we are serving over 100, 200 patients now. I believe this number could be very large. And this, I think, has increased the healthcare access to a large extent, I would say. Such things, in India, we have to accept that we are not a very rich country. So we need to prove more before we go to people and, the policy would change, right? So these are the ways in which you can actually prove this. So insurance has come, I would say, a lot of interesting things like Ayushman Bharat and others. They actually showed the data that we can reduce the cost and now I think it's running fine at an overall level.
Thank you for that answer. I think I'm just expanding on what both the wonderful panelists have spoken.
I've got a couple of things to add, so once you...
Certainly. Since the morning we've been hearing a lot of work that happens in the healthcare industry by the healthcare providers for patients. We don't hear very seldom what patients do for themselves. So what is the missing piece in this patient centricity? I think it's we ourselves. It says, na, maa bhi doodh nahi pilati jab tak bachcha nahi rota. And you can cry in a little room, you can cry in a little compound, but how does your voice, we heard about voice of patients as well. We had the previous sessions, we have these sessions. How do you carry the voice of patients to the movers and shakers of the industry? Unless we speak up, unless we know what to speak about, it's not going to happen. So while we acknowledge the pharma, the research, the clinical research, the devices, the manufacturers, the makers, the providers, the entire supply chain, what is missing? I think it's a summation of all the sessions that we've had, including and beyond the walls of the hospital. 90% of the problems, as he mentioned, and care can be taken at home. If I don't come to the hospital and report my symptoms, how will the doctor cure me? A classic example, somebody had a problem with indigestion, bad stools, diarrhea, constipation, change the food, change the water, change the country, until it ended up at stage 4 colon cancer. Another person had oral problems, toothache, gum ache, tooth implants, changing, gum pain, all that. The dentist for 2 years ignored, did not realize it could have been cancer, and continued to sell cleaning equipment or pain equipment. Both are at fault, the healthcare providers and the patients. So what are the two maladies which our panelists are trying to approach? One is awareness among customers, consumers, patients and families, and the second is communication. So the right patient education can be an enabler, technology can be an enabler, empowering them with policy, rules and legislation as they're trying. Support groups have to speak up, but most important I think is what IHW is doing. Getting all the stakeholders together. So this round of claps is for IHW, to get all the players in one room, under one roof, and contributing. So until all the stakeholders come together, we are not going to move forward. We'll work in silos, we'll pat our own backs, but the 7,000 to grow to 7 million and to 7 billion possible kidney patients or cancer patients is not going to happen unless we come together. And unfortunately, we're all in the game together. So I think holding hands, and I'm happy to be part of the Patient Safety Foundation, which is a CAHO initiative that is just spreading awareness among the masses on symptoms, possible causes, possible risks, and the consequences of not attending it. We do not give clinical advice. We don't want doctors. We're all patients, we're all caregivers, we're all survivors. I myself am a cancer survivor. Very nice to be here. Thank you. But that's not the point. The point is collectively with the right empowerment. And we are not just speaking, we are doing structural changes, as Nitinji said, by building patient advisory councils in hospitals where representatives from patients and doctors work together to find, identify, and admit that there are chronic problems, find common solutions, and give it back. So a suggestion, a request to all of us and to all of you, join our hands together to take this forward. Thank you for listening to that. I couldn't resist that. Yes, you wanted to say something, please,
Yes.
Ketanji, sorry.
I don't know what happened to my mic. Hello? Not working. Maybe. Yeah. There are 2 or 3 things that I have to add. One is that I don't know whether there are any actuaries present here, the insurers. People with disabilities are even today, and this happened last month, are denied insurance on account of their disability. Most ridiculous thing. Disability is not an illness, for God's sake. Disability is a condition, it's not an illness. And I have not met any person with disability who has had more risk and has died because of disability. And I'm 56 years old. Had that been the case, at least I would have met one. And so that is something that needs to be looked at. We of course are doing a lot of advocacy, but I don't know whether there are any insurers here, and if they have their own reason, they should talk to people with disability and try and resolve this issue, because I thought actuarial science works on evidence, and unless there is evidence, and this is happening despite IRDAI's clear mandate that no person will be denied health insurance on account of disability. So that is one area. The second area that I wanted to highlight is that when we are talking of people taking care of themselves or patients raising voice, many of the people who are disabled come from lower socioeconomic strata. Making life, making 2 ends meet itself is a huge challenge. They are not in a position yet to raise their voice. And hence, we will have to now look at developing systems which takes care of them. I mean, I am not for a minute ready to believe that India is a poor country, please. If you can give entertainment tax-free on IPL, and I'm a cricket lover myself, then I mean, where is the problem? IPL, which make crores and billions of rupees, if you leave it tax-free, then is it that we don't have money or we don't want to have it? So, let us start thinking with a different frame of mind. It's not the question of lack of money, but it's a question of lack of priorities. I don't think we give adequate amount of attention to healthcare. I mean, look at the budget. How much budget does Government of India have on healthcare? What percentage of GDP? Hardly anything. And hence, we as patients all of us need to ask questions of our policymakers. We, the disabled, are gradually starting to do that, but there are so many other challenges that people with disability are facing that healthcare is not even yet crossing their minds. I mean, when I'm talking of accessible and inclusive health, I am one of the very few, Prabhatji will agree, very, very few people in this country who are talking about accessible and inclusive health, which is a very, very sad thing. But why I have wanted to be in a forum like this is because at least by talking like this, there will be some conversation that will begin, which will lead us somewhere, if not now, maybe 10 years hence. So, I'm really happy to have had this opportunity to speak to this forum and IHW Council for looking at these various patient-centric issues. And I would want that the material that is produced by the council please be produced in accessible format. And let me tell you, accessible format does not cost extra money. It just needs some amount of knowledge and innovation. It can be done very easily. So if people say that accessibility costs money, maybe they probably don't know or they don't, because see,
Ketanji, can we ask the audience for some questions?
yes, I would want, and but let's not have this as an excuse that, paisa nahi hai isliye nahi kar pa rahe hain.
Thank you for patiently listening to us. Any questions from the audience, we'd be happy to answer. Or suggestions. Tea time, is it? I think I'll just summarize what they said and what Ketanji and everybody says, and close with our favorite statement. All of us are patients. I think the previous session mentioned that, and Prabhatji mentioned that as well. So let's take it upon ourselves, for ourselves. Don't wait only for the doctors and nurses to do their job, and say, my health, my responsibility. Can we all echo that? My health, my responsibility. Louder. My health, my responsibility. Thank you. Thank you for listening and give us, and we are very much in time. Thank you for that.
Thank you so much. Now I would request Mr. Kamal sir to come on stage and felicitate the panelists. Mr. Vipin Pathak. Mr. Ketan Kothari. Professor Nadira Chaturvedi. As we conclude today's insightful summit, we would like to extend our heartfelt thanks to our distinguished speakers, panelists, and participants for sharing their expertise and perspectives. The discussion today has been truly enriching, highlighting the transformative trends in healthcare and emphasizing the importance of collaboration in shaping a brighter future for patient care. A special thanks to our partners for today, Kioski Partners, Polyamina, Buhringer, Ingerham Angels, Food and Nutrition Partners, Medi Rest, a member of Compass Group, Session Partner, SUT, Super Speciality Hospital. We now invite you to join us for the delightful high tea, where you can continue networking and exchanging ideas in a relaxed atmosphere. Thank you once again for your contribution, and please note, our award ceremony will begin at 6 p.m. Thank you.
their dignity, health, and well-being.
It's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the consolidated daily reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं छिटी जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the consolidated daily reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीरा। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with the heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives, harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will leads to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं छिटी जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives, harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion. In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provides special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will leads to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the consolidated daily reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. A Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं छिटी जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीरा। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed, it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with the heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं छिटी जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives, harnessing the power of social media, the council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the consolidated daily reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं छिटी जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives, harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed, it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the consolidated daily reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते छिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will leads to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की ज़रूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीर। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
In a hospital, every meal served is not just food, it's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest app automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest app filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest app is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest app is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest app enables seamless kitchen operations for the hospital. Compass MediRest app, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest app, performance with a heart.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical.
Good evening, everyone. Hope you had a great time at High Tea. Let's move forward for fireside chat. For this, I would like to call on stage Mr. Prabhat Sinha, Mr. Vivek Tomar, patient advocate for lung cancer, co-founder Rise to Survive Cancer, to discuss on the topic, the power of patient advocacy. Please put your hands together. Over to you, sirs.
Time we have? How much time we have?
You can continue for
15 minutes? Okay. So, good evening, everyone. And it's my honor to have a fireside conversation with Vivek ji, a very dear friend, but I think those of you who do not know him, you will not be able to know him fully in next 15 minutes. And for that, you have to go to a site which is called Rise to Survive Cancer, right? It has a very powerful blog page, Twitter presence. I'm sure that you should go and start reading about that. And remember my word, when you will start reading it, you will not be able to stop yourself because it's like a novel, right? And it will motivate you. It is not about cancer. I think it is more about life and many more things. And just two line of introduction is Vivek ji has traveled just now from Delhi, is here. And he has been a caregiver of Kusum ji, who fought lung cancer at a very early stage of her life. She's no more physically with us, right? But I think when we think about patient advocacy, when we think about clinical research, when we think about introduction of new drug in this country, I think what she has done for the period she lived, I think for generations we will remember what she has done. And even she left. Most of the time it happens, and I have also witnessed that it becomes very difficult for people to continue that mission. But Vivek ji has not stopped. Probably he has 3x, 4x, 5x, he has increased his effort to continue this advocacy around oncology with lot of focus on research, access, innovation, and many things. So first, Vivek ji, I thank you for your time, and if you can give a kind of a little bit of journey and tell this audience that when we say power of patient advocacy, how you have witnessed this power of advocacy. So over to you.
Thank you. Really, really kind words, way more than deserved. So, I am Vivek Tomar. People know me on Twitter and the website as Rise to Survive Cancer. So this story starts somewhere 2010, 2011, when my wife was having, issues, a lot of issues, health issues, and she was misdiagnosed 3-4 times, and then finally misdiagnosed as brain TB, and she was treated for brain TB. And then in 2012 somewhere she was diagnosed with lung cancer. Stage 4 lung cancer means metastatic to brain, bones, adnexia, ovaries, and she was never a smoker. Okay, so first thing to take away message is that anyone with lungs can have lung cancer. It doesn't matter whether you matters, yes, smoking is a factor, but right now if you study, and I'm talking about facts, I always talk about facts, 50 or more % cases in India alone are never smokers in lung cancer, and I met 3 days back 8-year-old boy with lung cancer. Okay, so that's the fact. So please don't stigmatize lung cancer, because in October everyone is paying, Charminar is paying, Lal Killa is paying, in November nothing is white, and once treatment because of the stigma. So story progress, and then Kusum, the very brave girl, she asked the oncologist how much time she do have, and I was not ready with that question, and I started to cry in the oncologist chamber, and doctor said no, 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 and she said I want the answer, and the answer was based on fact, 6 months, if you are lucky 1 year, and that happened. Within 6 months she went into coma. So fast forward, luckily we found that there is new medicine which is world first targeted therapy, first generation targeted therapy, was conditionally approved in US, and we sell our property and everything what we do have, our paternal, maternal side, everything, and we purchased that medicine for few months. She survived, and then that medicine came, and it was 2012, 2013. She got better, life starts. Again, there is a R word in the kingdom of stage 4 cancer, that is resistance. So resistance came, and we thought that we will get medicine, but by that time we came to know that lot of or something bad happened in clinical trials in the world of India, and then they have stopped rules, regulation, and then media was about guinea pig. There were medicine, there was a trial happening for a drug in again US, Europe, Singapore, and Hong Kong, but not in India. Kusum progression was very bad. She went on bed, and doctor said, go to home, take care of her. But I didn't agree. I can't take her home just to be for final goodbye. So that's, I was crying, and Kusum said to me that whatever time we do have left, either we can fight or we can cry, and that changed Vivek forever. And then from that day, my journey of patient advocacy started. A journey was started to save Kusum, which I believe now able to save millions of people, because then I went from corner to corner, government to government, conferences to conferences, and even the wherever the government or oncologists are going, or pharma companies were going, fighting with them, going to media, and that trial got approved, especially for Kusum, when this became a huge news, this campaign. And on 1st January, which is birthday of our son, she became the first patient from India to have the that medicine. And then obviously after a lot of other patient gets enrolled, she again survived. Again same thing happened with resistance. This time she got paralysis attack. And the company, which was again a new trial was there, and they said that they can't come to India because India doesn't have market and our policies, all those things. So again doctor said, go, take home, take care of her, and I was not ready, and I will never be ready. So again fight, and then luckily some good people, either from industry, from the medical community, media, NDTV, G News, everyone came to support by time when I was on the road, and we sent videos to the headquarters of that company in Switzerland. And then in 2017, 17th January, again she became the first patient to get that medicine. And after 9 months in September of paralysis and that medicine, she was running in marathon in Delhi. And by that time, she had completed 5 years, wearing a T-shirt that if I can survive 5 years with hope, courage, research, trials, so why can't you? And that was covered by Hindu and everyone who was there. So long story short, she survived. She was given 6 months. She survived 6 years. She was and me was able to bring she became the longest survivor of Asia at stage 4 of her cancer at her time, and we were able to bring all those medicines, whatever available until now. And now she passed away, but my son asked, so I'm not a god, I can't, I was not able to save Kusum, but I was able to have to leave her longer, so that my son, who was 3 years old at that time, now can remember what my mother was and how great she was. So in her memory, I continue to work. I am the advisor for Government of India, Punjab, farmers and policies. And I strongly believe that, and I was saying to someone, that in India there is a biggest problem that we see patients at that corner, and everyone, either we are industry or conference organizer or oncologist or minister, but we forget everyone that we are patients in our life in one way or other, either our family member, and there is no guarantee that we or our family member can become a patient tomorrow. And when it happens, the table turns. And I'm telling you with a fact, because one of the a young radiologist, a famous radiologist at very young age, called me, who got diagnosed with EGFR lung cancer 2 months back, and he was literally crying while talking with me, because when table turned, he found how tough it is. And then he was saying that I never thought about these things. So if you want to take away few messages, that remember we all are patients, so don't treat patient that way. As together we can make this world, this India with a better healthcare and more equitable.
Thank you, Vivek ji. And I don't remember the years, but few years, almost 6-7 years back, I was at Vivek ji's home, and I was not aware, so we were doing some a small film, I believe, and at the end of the day, he asked me to wait for a few minutes, and he said, I'll come in 10 minutes. And then he comes with a cake. Can you believe what was written on the cake? It was their cancer anniversary. And I witnessed that day. Very tough to kind of celebrate cancer anniversary. But when you think about problem, when you think about positivity, I think that positivity, that day I witnessed, maybe first time for me. When I witnessed that how happily, and when I say happily, there was a lot of pain inside, but at least everybody used that occasion to have that hope that we will celebrate another anniversary next year. And this continued for 6 more years, right? And I kept seeing that cake for next few years, and we always wanted that this cake comes again every year, right? But I think it's not, sometimes people say it's, but I think every minute, every day, every hour, the way she fought, and I think I'm fortunate to have witnessed her, to see what she was doing, right? And those many of us sitting in this room who have witnessed her speaking on television or speaking on a forum like this, the condition where she lived, coming forward, and she never stopped herself. She always pushed herself and did that. And I think a lot of credit in a way goes to both of you to keep this this whole fire, and she will be very happy seeing what Vivekji you do every day for her, and as you said, for many other Kusum. If I want to ask you, one of the things since morning we have been discussing is about access to healthcare, right? Access is a very big word, and we end up sometime coming down to cost. That, why we are not accessing healthcare, because it is very costly. Is cost is the only thing which is an obstacle in accessing healthcare? That is one. And second, many times I have heard you speaking about equity in healthcare. That everybody is getting what he or she deserves to get, or some of us get something different. For example, in this room, there is an equitable access of coffee. Had it been Kamalji kept another room for a coffee where only privileged one will go and have that coffee, that is not equitable access to coffee. But if you see this premise, it's open for everyone. Each one of us can go and have the same coffee. But is it happening in our country? With so many programs going on, is healthcare accessible and more than accessible, equitable accessible? What is your take on this?
Yeah. So actually this is very, very unfortunate situation, and let me tell you again a live example. I always believe that let's humanize the problem so that everyone can understand. So there was actually a lady, only 26 years of old in Punjab, house help. and she got diagnosed with cancer, and she had a baby of 1 year and 4 years, and her husband was passed away due to an accident couple of years back, and she was surviving, and she got diagnosed with cancer. Chemotherapy happened, but it didn't work. But she has a mutation which found, and that medicine was not accessible because the cost was 5 to 10 times of her monthly salary. The monthly cost was like that. So, and she was waiting to be died. That's how the situation in India is, because in the same town, someone was having that medicine, and she was dying, and her children was waiting and praying, and I and few of the others tried to purchase and do the things. But I always say कि हम कब तक कितनों को बैसाखी दे देंगे. Important is not बैसाखी, because you can't give बैसाखीs to everyone. Important is to create a condition कि किसी को बैसाखी की जरूरत नहीं पड़े, and that's policy, that's advocacy, is a journey from what it say, what should be. And she passed away 3 days back. Okay, with no father, the kids with no father and no mother. And my issue is now, I believe it was not a matter of cost, because for few months we were able to give, and government gives 5 lakh rupees, and the medicine yearly cost was less than 5 lakh rupees in Ayushman Bharat. So my question was, and that I said to in one of the meeting with Ayushman Bharat officials after her death, I had a call and said that, this is the matter of equity, this is the matter of willpower, this is a matter to make things right, because the government official, the central government who are making the policies, either they are rich or super rich, or they do have this CGHS scheme in which everything is reimbursable. So they don't understand. If you don't understand the problem, how you are going to solve the problem? If you are, or at least don't say no to the problem, meet with them, because for those children, their mother has gone, and still the one kid is 2 years old and other one is 6 years old. So I think cost is a median factor. The issue is not understanding the problem, and then not realizing that access is different thing, affordability is different thing. In India, we do have access because that medicine was in the same city. Okay, we do have affordability because someone was able to afford. The issue was is equity, that if you are poor, you can't access, and it happens to everyone. Even if you are not poor but of middle class, then this equity access is with all of you, because there are a lot of medicines which are available in US but not in India. So when you need those medicines, the equity issue is with you. So I believe, in the public health, there is a belief of every voice matters. But in public health in India, there is an issue. That issue is not understanding that every life matters. And until and unless every life matters, we are failed as public health.
I think very rightly said. Every life matters, and that's why equity of care is very important. As when we think about a program like Ayushman Bharat, are they getting the equitable access to care? The same care what maybe in some of the reimbursement people enjoy and get. And it also, for many of us, for example, as you know, sometime even, a few days back, somebody called and he says that, I should be actually very poor. Then I would have got some benefit from government, or I should be very rich. It's a crime to be in that, middle class. Right, because everybody feels that you have an income, but I don't have an income to spend on treatment. So it's not about the income, but it's about the disposable income which I have, which I can spend on medical care. Even health insurance, for example, the kind of health insurance many of us in this room have only covers the hospitalization expenses. While the treatment has moved from hospitalization to targeted oral therapy for disease like cancer, for example. But even if you have an insurance of 15 lakh rupees, but you may not get reimbursement for oral therapy, which is much easier, better in many ways. So I think it's a long way to ensure that these are accessible and more than accessible, equitably accessible. Now, Vivekji, another question to you is, we have been discussing, again, there were two panels before this, which discussed about power of patient's voice and power of patient advocacy. You are now not only a voice of patient from India, but now you are also part of many global organizations and you have been representing country in many of those forums. You are also part of National Cancer Grid, which is a kind of a think tank in India when it comes to cancer care and making policies. How you see this journey and where we are when we talk about patient centricity and when we talk about patient advocacy, power of patient voice, where do we stand today?
So things have improved for sure, because there was not a table for patients in past. There is now a table, but the issue is that whether they are being listened, okay, and then whether they have the voice and whether their views are being done. So there are change, but we are far, far behind. So I will give you an example. 1 month back, there was a government level meeting, US or India, that is called US Moonshot meeting. You know, Moonshot, everybody who knows about cancer. It is US President pet project, and our PM was very much involved. So whole US team, including their US FDA head, was India, and in India side there were DCGI head, health secretary, and all the oncologists and surgeon. But US team has one change, or one thing additional. They bring 10 patient advocates with them, and in India team there was not a single patient advocate, despite it was happening in Delhi, in India. So that's the difference. And to connect the world with the human. And sorry, I'm not making this atmosphere dull. I'm just a mirror to ourselves. It's a mirror, because if we will not tell truth in a forum like Patient Summit, where will we? Otherwise, everywhere we are keep praising each other. So I'm just telling the fact. So this is the issue. Means I was single. So someone told me, and I was in a meeting. There were all the top level people who advise governments, and Padam Bhushan, Padam Shri, and someone in WHO, and the top guns, and they were saying that we can't do much. And I stand up and I said that I was one individual, and if I was able to bring not only those medicines but my research, and I was able to also work with government single-handedly to change lot of clinical trial policies, because research saves life. It saved my wife's life. So what we can do together? So that's the problem is, in that room there was not a patient advocate. So I was in a meeting with DCGI and everyone. I was invited, me and Kusum were together. And before our turns came, there was a discussion, industry, oncologist, and government. It was a discussion of like property, commercialization, your product, this product. And when Kusum and I started to speak, everything changed. And in that single meeting, 7 clinical trials related rules were changed. That was the impact of patient voice. You cannot underscore the patient voice, because they are the living voice. You may be expert of your voices, your areas, but patients are the expert of their disease, and no one can better realize them. And now, with the same reason, I am now the advisory and doing training for whole APEC. So I did in Hong Kong last month, and I am going to Africa and doing a same training for the patient advocate, so that patient voice come. And again, especially in cancer, we cannot win alone. Neither patient advocate, neither oncologist, neither company. We all have to come together, because cancer doesn't discriminate, but we are discriminating.
And I just reminded me, I think 2-3 years back, Vivekji was acknowledged by International Lung Cancer Union, ICLC, for the Patient Advocate of the Year globally, right? More than award, I think it was a testimony that patient voice from India can also represent globally. It was the first time. It was the first time, because most of the time when we see patient advocates, we always think about people from, Western country. But it was the first time when Vivekji represented in India. It was in which country? US, Canada, and got that. And I'll tell you, very recently, this year, when our friend Raviji, so Ravi Prakashji, he was a journalist from BBC, very active, those who are on Twitter, on social media. He got lung cancer. Till the last breath, he also kept raising his voice. But he was, after Vivekji, he was the second patient advocate from India awarded at the same forum. So it's one leader, gives that encouragement to many other leaders. And Vivekji, thank you for kind of motivating people to come forward and speak about their own disease. It was not easy in this country, but when people like you continues this mission, it's not easy to, sometimes I feel I scratch your, old memories and take you back 12 years on a forum like this. But it takes a lot of courage for somebody to, go back to those painful years and remember. But you do it consciously to educate us, to make us more sensitive, to make us more educated and aware about the issue. Otherwise, none of us will, try to remember our bad times.
Yes.
Do we? Never.
Yeah.
We always talk about our good times. But, it takes a lot of courage to do that.
Yeah.
So, you wanted to say something?
Just to say, so, and it's important to understand, so you may found our lot of videos, mine, Kusum, is still going on. And then if you go, there were obviously good comments, but there were a lot of abuses also. Abuses, if we talk about clinical trials, so are we being paid from the companies? If she got lung cancer, you are lying, you must be a smoker, your husband must be a smoker, because people have mouth. But I thought at that day, that once, there was only one time I was really frustrated, but I said, if not me, then who? Okay, and if it's no, if not Kusum, then for whom? And after Kusum, who knows about my kid? Who knows about their kids? We may not be in this world for longer, but our generations to come. So if not us, then who? And life is very small, my friends. Life is very small. Do whatever you can do to bring some smiles and hope. We cannot save anybody. We are not God. We cannot save anybody. But I can show you a message which I got today itself. A patient whose mother died, and after even death, he wrote me that, Vivekji, thank you. And I saw that his mother died, why thank you? And said that she was able to live longer and with happiness and with hope because of you. If we cannot make anyone longer, at least we can give them hope. We can give them a smile. And I remember Kusum words when we talking is, so once a journalist asked her, are you a guinea pig? She was participating in clinical trial. And she said, and that's Kusum for you guys, that if being guinea pig, I am living in my 6th year, then I'm proud to be a guinea pig.
I think this is a perfect line to continue this conversation, not end this conversation, right? Because that courage, that openness towards innovation, towards research, and the whole, and I always say that this conversation, I think many times I got this opportunity to speak with you, Vivekji, and every time, it becomes a kind of a fresh conversation. But this conversation or this chat is not about cancer only, if you remember. This is all about life. This is all about love. This is all about affection. This is all about, if there is no love, there is no affection, why he is doing this, right? So it's more you think, and that's why I will encourage each one of you today to go and visit this page, Rise to Survive Cancer, right? Because this page is being maintained since how many years? 16 years? 16 years. And it's like a kind of a TV serial, you can say. It's being updated every day, every month, every week. And Vivekji has not left that page to, keep updating it. And it's a journey. It's a journey of struggle. It's a journey of survival. It's a journey of life, everything. So please read it. And if you and as I said, I challenge you that you will find it very difficult to stop that where I should stop. I have heard from many people that I started and I kept reading it throughout the night, right? But if you really want to understand what patient centricity means, I'm overemphasizing read that blog, right? That is one. Now, I see 4 minutes left. I give this forum for you all to ask any question you want to ask to Vivekji. So we have 4 minutes to have that dialogue or conversation. Yes, please. You are audible, but if a mic can come quickly.
So it's always inspiring to hear such acts. Kudos to you, Vivekji, for heralding this movement. But I'm a pulmonologist based in Kolkata. So I'm an interventional pulmonologist. So there's lung nodule, early stage lung cancer, I diagnose. But then I find it very hard to break the news to the patient. So I would like to have your inputs as to how do I break, like the first person whom your wife met or broke the news to her said she has 6 months to live. Obviously that was discouraging. So how would you want, as a doctor, I want to learn from you, so how should I break the news to the patient, keeping all the sensitivities in mind so that she and the family doesn't lose hope when I break the news, as well as I give him or her a realistic picture as well? Or is it wiser to break the news to the relative first and then have them break news to the family member or to the patient, or directly talk to the patient? So I don't know how to proceed,
So this is the very interesting thing is that we misjudge patients most of the time, even as caregivers. There was a case again few days back where caregiver was not telling the patient that she has cancer, and it was breast cancer. But patient knows, because they knows their body. Patient knows from well before even they started to share with the family that something is wrong. They know that something is wrong. There are two components of it. I strongly believe that sharing openly with facts and truth is very, very important, because there you will build the trust, because there is huge deficient of trust right now in the whole system. And if patient stop to trust even the caregiver, things become really, really bad. But if obviously they will react and they will cry, we cried, but they know that what the situation is and how much hope we do have. So obviously the empathy is the biggest component, and which is almost negligible in most of the cases, either because of lack of time, and I agree, you clapped, because no one asked this question ever before, despite knowing that they are really, sharing those news on everyday basis. So I think the recipe would be going with empathetic, sharing the news, not just with the world with the cancer, but this is the thing, that is the thing. But if you are going to share the news, then you have to share the hope at the same time. And at this stage, there are hope. So I remember in one cases, I was there in one of the patient, and we took the page, and then we do have different type of options, and then we do have examples. Obviously, a single medicine, particular medicine in particular disease or particular mutation behave differently, but there are examples. So, for example, the clinical trial, which first clinical trial Kusum participated, a patient was enrolled in that trial, and that patient had completed 10 years last month. So there are hope, there are a lot of hope. So giving those example and be factful that everything could happen, but it could happen to heart disease. Everyday heart attacks can happen. If you will go through my book, there is a video on Josh Talks about Kusum and mine, And Kusum has said one thing, and I think right now every cancer patient in India watch that video of ours and do connect with me. And there is a line Kusum said that हमारे पास लड़ने का चांस तो है ना. बहुत लोग ऐसे हैं जो हाथ एक्सीडेंट में, हार्ट अटैक में एकदम ख़त्म हो जाते हैं. कैंसर में लड़ने का चांस तो है ना. And final thing I would say, always say whenever I connect is that we have to fight. जो कुसुम ने मुझे कही थी और मैं बाकी लोग कहता हूँ, because losing is not an option for us. अगर हम हार गए तो हार ही गए, और आप चले जाएंगे, पेशेंट चला जाएगा, पीछे वाले बहुत बहुत रोते हैं. तो losing is not an option and let's fight.
So with this, that at least disease like cancer gives you an option to fight, right? And I think a forum like this strengthens that spirit of fighting. What minimum we can do is to partner, to support, to listen, to act when somebody is fighting in this country. And I think forum like this, when this very valid questions comes from you, I think Kamalji sitting here would be very happy, and you should be very proud, because maybe forum like this, starts a conversation like this. Some questions which maybe never been asked, as Vivekji said, but somebody will come up, gather that courage and ask that question, and then things improves from where we are. So I would also like to thank IHW Council for creating this forum, a very different forum where, you listen to people very empathetically, but it's not only being emotional, right? I think what is important is, and sometimes we become emotional, but we also lose that emotion when we go out. Important is that, yes, have that empathy, but do something which next time when you come to this forum, you should write and say that from December 2025 or 2024 to 2025, as an individual, as Vivekji said, that each one of us can do something different which will help somebody in some or the other way. I think that will be the best gift that you can give to lot many who are fighting, and will make this whole effort what IHW Council is doing to bring patient's voice forward, to make patient first summit, will really make that. And I think if each one of you sitting in this room have that power. We are not talking to somebody who do not have this power. You have that power. As sir said, that tomorrow if going back, maybe his patient finds a difference the way you break that news. I think the objective or the mission of this forum is done. So make a commitment, take a place that we will not look at the other person. We will look at ourselves and we'll do one thing which we should be pride and say that yes, we have made a difference when it comes to patient centricity. With this, thank you so much for listening very patiently at this hour, and I give it back to the organizer. And Vivekji, I cannot thank you in words. I think it is beyond that, and my honor and my privilege to have a conversation with you, and all the very best from each one of us sitting here. A lot of people who are watching this program on YouTube. I think more power to you, and I think you will save many lives, you will encourage, you will change many people like you have changed even me, right? So we will continue learning from you and look up to you for doing something different what we do every day. Thank you so much.
Thank you so much. Please come on stage. I would like to request Mr. Prabhasina to felicitate Mr. Vivek Tomber. We are setting up the stage for the award function. After a day filled with insightful discussions and meaningful conversation, we are gathered here to welcome 3rd edition Patient First Awards tonight to celebrate those who have made remarkable strides in patient care. This evening is dedicated to honoring the individual, organization, and the companies that have put patient at the heart at their work and making a last impact on healthcare through compassion, innovation, and commitment. As we reflect on the conversation and ideas shared today, we are reminded of the collective effort it takes to drive change and improve the lives of patients everywhere. Let us come together in gratitude and celebration of those who continue to lead with empathy and excellence. As we move forward, we are honored to introduce our esteemed jury, a group of distinguished leaders and experts from diverse fields in healthcare, whose experience and insight have been invaluable in selecting the awardees for the year. Mr. Sudarshan Jain, Mr. Prabhas Sinha, Dr. Urvashi Prasad, Dr. Amit Patki, Dr. Anil Matai. Please give a huge round of applause for these people. Leading the jury is Dr. Indu Bhushan, former Chief Executive Officer, National Health Authority, Government of India, a visionary in healthcare, whose dedication is excellence and patient-centered care has inspired many in the industry. I request the digital team to kindly play his message for the gathering.
Good evening, everyone. At the heart of every successful healthcare system lies a very simple yet profound truth. Patients must be the central focus. Their dignity, health, and well-being are not just the outcome we strive for, but the very purpose of our efforts. The challenges before us, addressing inequities, ensuring quality, and adapting to rapid advancements are formidable but not insurmountable. They require collaboration, bold ideas, and decisive action. The Patient First Summit exemplifies this spirit, serving as a vital platform to inspire innovation, shape patient-first policies, and drive real progress towards more inclusive and compassionate healthcare systems. As jury chair, it is my privilege to honor the nominees and award winners whose exceptional contributions embody the principles of patient-centered care. Their dedication and innovations set benchmarks for all of us, inspiring us to aim higher and do better. I also want to thank all jury members for their diligent work in selecting the winners today. Let this moment serve as a call to action for the healthcare community. By prioritizing patients and fostering collaboration, we can build a healthcare system that is equitable, innovative, and deeply compassionate. A system that truly puts people first and leaves no one behind. Thank you.
Thank you so much. As we move forward, I would like to call up on stage Mr. Kamal Narayan and Mr. Prabhat on stage to distribute the awards. I would like to invite Dr. Sivanti, Director of Medical Oncology at Sir H.N. Reliance Foundation Hospital and Research Center. I would like to request Dr. Sivanti to come on stage and say a few words. Please give a huge round of applause.
Thank you, and first of all, I'm really sorry I'm quite late. But I thought even if there were 4 members in this room, I will come. So that was the spirit with which I have arrived, and mainly serving patients. I just want to say that I am here today and I'm doing whatever I'm doing in my life mainly because of the inspiration of patients. I've said this many, many times in my talk. I came into oncology not because of the science of oncology, but because of the spirit of oncology. And I truly mean it. In my history, when I talk about how I became a medical oncologist, I always speak of this moment when I was a young intern at Sloan Kettering Cancer Center, and I was sitting in the audience just like you are sitting. I was sitting in the audience and a patient advocate was speaking. This was, I date myself, almost 25 years ago or more, in New York City at the Rockefeller Center. And the person who was speaking was Dr. Richard Rockefeller himself. Dr. Richard Rockefeller was a chronic myeloid leukemia patient. And he was my first memorable patient advocate. He was advocating, actually, he was conveying how he advocated for imatinib to become to get fast-tracked through FDA and to get approved. There were 200 trial survivors of the imatinib study, and they had petitioned the government, the FDA, to approve imatinib on a fast-track basis so that beyond trial access of the drug was possible. And I can tell you, several of these imatinib trial members, when I say several, I mean above 90% of these imatinib trial members actually lived on to lead a full and complete life. And Dr. Richard Rockefeller's discourse in that meeting was pivotal, was transformative. That is what got me glued to oncology. I had just gone to Sloan Kettering as a routine intern doing an elective and never left the subject. And here today I come mainly to celebrate the spirit of oncology, the die-hard, the tenacity that we see in each one of our patients and that inspires us every step of the way. In the face of the inevitable, the way our patients forge ahead, you all forge ahead, is something that I bow my head to. I came on this side of the table when 2 years back, my mother was diagnosed with advanced lung cancer. I have also been touched by the disease as a caregiver. And today, as it's 6 months of losing her, I realize how the battle is fought, won, or lost, or never lost. And so I feel I'm one with everyone in this room. And together, to add to this voice, I thought I must come even though I'm late. So thank you. Thank you again for having me, and you inspire me every single day for the work I do. Thank you again.
Now, I would like to call on stage Mr. Kamal Narayan sir and Mr. Prabhas sir to distribute the awards. Along with that, Dr. Sivanti is also going to distribute the awards. Our first award category, Patient-Centric Public Health Advocate of the Year, goes to Mr. Vivek Tomber.